Infectious diseases, preventive medicine and clinical species conferences. Mammal and avian salmonellosis. Salmonellosis in livestock is caused by infection with both host-specific and non-host-specific Salmonella serovars, and results in enteritis, septicemia or abortion. It is an economically important disease of cattle in many parts of the world, but may also be responsible for serious sporadic outbreaks of disease in sheep, horses and pigs. Carrier animals and contaminated environments are important sources of infection. The most common serovars associated with disease in livestock are listed down in Table 1. The genus Salmonella is classified in the family Enterobacteriaceae, whose members are gram-negative coccobacilli. With the exception of Salmonella Gallinarum Pullorum, all Salmonella are motile, as they have peritrichous flagella. The genus Salmonella consists of 2 species, S. enterica, which comprises 6 subspecies. The distinction between subspecies are based on biochemical reactions, and S.bongori. Salmonella enterica subsp. Enterica contains all the serovars found in warm-blooded animals, those formerly assigned to subgenus 1. The members of the genus Salmonella are typed into serovars which are differentiated from each other by the combinations of their somatic, O, and flagellar, H, antigens and, to a lesser extent, by their biochemical reactions. The serovars, of which over 2,500 have been identified, do not have a species status allocated to them in the current classification of the genus, and the names of the serovars, such as Typhimurium or Dublin, should be used without italicization or underlining, and with the first letter capitalized. S. enterica subsp. Enterica ser. Typhimurium. As it is tedious and impractical to adopt this long, formal nomenclature for everyday use, it is common to refer to serovars as, for example, Salmonella typhimurium, or as serovar typhimurium. The most common serovars associated with disease in livestock. The O antigen is part of the lipopolysaccharide component of the cell wall that also contains lipid A and a core portion. The O antigen, or O-specific side chain, consists of repetitive oligosaccharide units of which the type, order, and repetition of sugar moieties differ between serovars. These differences and those in the flagella antigens are used to type Salmonella into serovars. At least 67 different O antigens are currently known, and they are identified by the Arabic numerals 1 to 67. Some of these occur singly, 11, while others occur in combination, 1, 4, 5, 12, and 6, 7. Some Salmonella mutants have defects in the synthesis of the oligosaccharide O-specific side chain, with the result that the oligosaccharide is not fully synthesized when cultured. The colonies of such mutant strains have a ground glass appearance and are therefore referred to as rough strains. Colonies of strains which possess the complete oligosaccharide O-specific side chain are smooth, and the strains are therefore referred to as smooth. Rough strains are untypable as they do not agglutinate with O-typing antisera. The complete O antigen is not only the major immunogen of bacteria in this genus, but it also possesses virulence properties. It elicits both humoral and cellular immune responses to infections by salmonellas. Strains with incomplete O antigens, rough strains, are therefore used for the production of live attenuated vaccines, such as the calf paratyphoid, Salmonella Dublin, vaccine. The H antigens are heat labile and are an integral part of the flagella and those serovars which possess them. The antigens are designated by a combination of letters of the alphabet and numerals. 2 antigenic forms, also referred to as phases, of the flagella may occur in culture. A culture may therefore contain cells in which the flagella are all in the same phase, or cells which possess flagella of both phases. Most of the serovars contain flagella of 2 phases, but in some the flagella occur in only 1 phase. In order to establish the complete antigenic composition of any Salmonella serovar, antigens of both flagellar phases must be known, as well as the O antigens. This is done by testing suspensions of the bacteria against antisera produced in rabbits against individual O and H antigens by means of a series of slide agglutination tests. For identification purposes, the results from these agglutination tests are then compared with known antigenic formulae contained in the Kaufman-White diagnostic scheme. In this scheme, the antigenic formula has 3 parts: the O antigens, the phase 1H antigens, and the phase 2H antigens. As new serovars of Salmonella are constantly emerging, the Kaufman-White scheme is updated annually. The biological effects of the virulence factors of Salmonellas are interrelated and are responsible for enteric and systemic clinical signs and lesions of Salmonellosis. Lipopolysaccharide, apart from the fact that the O-specific side chain of the LPs is immunogenic and is recognized by the host's immune system, it has also been associated with invasiveness of Salmonellas and enterotoxin production. For example, Salmonella strains with incomplete O-specific side chains, rough mutants, are not as invasive as those strains with a complete O-specific side chain, and are also less successful in avoiding phagocytosis and lysis by phagolysosomes after invasion. Endotoxin-mediated effects in clinically affected animals are attributed to the lipid A portion of the LPs. Vasculitis and thrombosis, which may be present in the intestine, liver, spleen and other tissues of affected animals, are thought to be the result of absorption of large amounts of endotoxins through the damaged intestinal mucosa, or of endotoxin that is released locally in infected tissues. The cytotoxin may also be involved in the pathogenesis of the vascular lesions. Enterotoxin. Several serovars of Salmonella produce an enterotoxin similar to the heat-labeled toxin of Escherichia coli and the cholera toxin produced by Vibrio cholerae. The enterotoxin binds to intestinal epithelial cells and stimulates increased intracellular cyclic adenosine monophosphate, which leads to the net secretion of C-, HCO3-, Na+, and water into the intestinal lumen, resulting in diarrhea. See the movie at PW. Cytotoxin. Some serovars of Salmonella produce a cytotoxin that causes increased permeability of intestinal epithelial cell membranes. The cytotoxin appears to chelate cations, such as Ca++ and Mg++, which it is thought to cause structural changes in the cell membrane, resulting in rounding of cells and selective leakage of molecules. Adhesion pili, Fimbriae. Salmonellas possess type 1 pili which facilitate the adhesion of bacteria to epithelial cells. The differential expression of various Fimbriae by Salmonella is likely to be due to the wide variety of mucosal surfaces that are encountered by various strains, and the host immune system may select for a different expression pattern. Plasmids. The virulence of the most common serovars that cause disease in livestock is enhanced by serovar-specific plasmids, which provide these serovars with the ability to survive in macrophages. Salmonellas may carry plasmids that provide resistance to some antimicrobial drugs. Salmonellas have simple nutrient requirements, and growth in vitro is therefore possible in simple salt glucose media, occurring over a temperature range of 10 to 49 degrees Celsius. At temperatures between 0 and 5 degrees Celsius the organisms remain viable even though there is no growth. Selective procedures are used for the isolation of Salmonella from specimens such as feces that contain a mixed bacterial flora. Enrichment media, such as a liquid nutrient broth that contains agents which selectively inhibit the growth of other bacteria, are used for this purpose. Enrichment media commonly used are tetrathionate broth, Rappaport Vasiliades medium, and selenite F broth. Small pieces of tissue from the spleen, liver, mesenteric lymph nodes and/or the small and large intestines, or small amounts of feces are each inoculated into the enrichment medium and, after incubation at 37 degrees Celsius for 48 hours, a loopful of the medium is plated onto a discriminating agar medium such as McConkey agar, XLD agar, brilliant green agar, Salmonella shigella agar or Rambach agar. These media differentiate the genera of the family Enterobacteriaceae according to differences in lactose fermentation and other biochemical reactions. Serovars of the genus Salmonella are non-lactose fermenting, as are members of the genus Proteus, and some strains of Citrobacter and Enterobacter. As all these bacteria are morphologically indistinguishable from each other, they are further characterized by the biochemical reactions that they induce in suitably prepared media. Salmonellas are facultatively anaerobic and, with a few exceptions, all produce gas from fermentable sugars. In culture, nitrates are reduced to nitrites, and hydrogen sulfide is produced. Glucose and maltose are fermented, dulcitol and inositol are variably used, and sucrose is not fermented. The other non-lactose fermenting genera of the family Enterobacteriaceae which also produce hydrogen sulfide are Proteus and some strains of Citrobacter. The biochemical differentiation of these enterobacteria is given in next table. The biochemical differentiation of enterobacteria. Bacteriophage typing schemes for a number of important Salmonella serovars have been developed, S. typhimurium and S. enteritis, and are used internationally for epidemiological studies. Certain phage types have been found to be commonly associated with particular animal species, aiding in the identification of potential sources of human infection. Phage types are designated as either PT, S. typhimurium PT 135, or DT, definitive type. DT is commonly reserved for important epidemic phage types, multi-antibiotic resistant S. typhimurium DT 104. Factors affecting growth and survival. Salmonellas are killed when exposed to temperatures of 55 degrees Celsius for 1 hour or 60 degrees Celsius for 15 to 20 minutes, and by pasteurization at 71 degrees Celsius for 15 seconds or 63 degrees Celsius for 30 minutes. The cooking of food will destroy salmonellas if the temperature of the food reaches 74 to 77 degrees Celsius. Salmonellas in animal feeds and feed ingredients are killed by a process where the feed is heated to boiling point in steam-jacketed agitating cookers. There is a marked reduction in the number of salmonellas during freezing and long-term frozen storage, but not all are destroyed. Salmonellas are able to grow in media with a pH range of 4,5 to 9,0. Lower or higher pH values will kill them. Bovine salmonellosis usually manifests clinically as a syndrome of septicemia, acute or chronic enteritis, or abortion. One or more of these syndromes may occur simultaneously in the same animal or herd. Calves less than 3 months of age are most commonly affected, while animals exposed to stressful situations are particularly prone to contract the disease by Salmonella St. Paul. Although salmonellosis in cattle is caused by a number of different serovars, Salmonella Dublin, enteritis, Rostock and typhimurium are by far the most common. The source of infection is usually an environment contaminated by the feces of either clinically affected or carrier animals. Carrier animals play an important role in the epidemiology of salmonella infections. Salmonellosis is a zoonotic disease. Salmonellosis in both calves and adult cattle occurs in most countries of the world and has been shown to be economically important in Europe and North America. In any outbreak, the economic impact will depend on the rates of morbidity and mortality. Serovars of the genus Salmonella are identified on the basis of specific combinations of somatic and flagellar antigens and, to a lesser extent, by their biochemical reactions. Salmonella Dublin, S. Rostock, S. typhimurium, S. enteritis, S. St. Paul are the serovars most frequently associated with bovine salmonellosis. Other serovars, S. Newport, S. bovis morbificans, are incriminated rarely. Epidemics due to S. typhimurium phage types DT 104, DT 193 and DT 204C, which are resistant to a range of antibacterials, such as chloramphenicol, have emerged since 1977. The phage type DT 104 possesses in vitro resistance to ampicillin, chloramphenicol, streptomycin, sulfonamides and tetracycline, as well as apomycin, and has also been detected in France and the USA. Of even more concern is the increasing emergence of trimethoprim and fluoroquinolone resistance in phage type DT 104, and that resistant clones can spread rapidly. The diseases in cattle caused by different serotypes are clinically indistinguishable, but they differ epidemiologically. The host preferences and the ability of the two serovars to establish carriers in animals following initial infection also differ. Salmonella Dublin is regarded as a serovar specific to cattle and only rarely infects other species of animals and humans. On the other hand, most other serovars, including S. typhimurium, are not host-specific, and direct or indirect transmission of S. typhimurium between cattle as well as from other domestic or wild animals to cattle, and vice versa, may occur. Important epidemiological differences between Salmonella Dublin and Salmonella typhimurium infections in cattle. Calves aged between 2 and 12 weeks are the most frequent victims of salmonellosis, but mature cattle may also suffer from clinical disease. In calves infected with S. Dublin, salmonellosis usually occurs at between 6 and 12 weeks of age, whereas disease caused by S. typhimurium is most common in the first 3 weeks of life. The possible explanation for this difference is that S. Dublin infection is more prevalent in adult cattle than S. typhimurium. Consequently, the presence of colostrum immunity to S. Dublin is more common in calves than immunity to S. typhimurium. Disease is much more common in dairy than in beef calves, mainly because of differences in management practices. In contrast to the general husbandry practices applied to beef calves, dairy calves are usually removed from their mothers at a very early age, and many of them are then subjected to the stresses of transportation, starvation, changes in environment and feed, and mixing with calves from different farms. These factors all predispose them to salmonellosis. In outbreaks of bovine salmonellosis, the morbidity rate may reach 50%, while the case fatality rate in untreated animals can reach 100%. Managemental, physiological and nutritional factors, as well as intercurrent infections, not only predispose animals to salmonellosis, but may also precipitate clinical disease in infected cattle and the excretion of the bacteria by carrier animals. Predisposing factors for calves include unhygienic conditions, overcrowding, transportation, insufficient intake of colostrum, inadequate availability of water and food, and inclement weather. Hospitalization, surgery, overcrowding, parturition and sudden dietary changes can predispose adult cattle to salmonella infection. Intercurrent infections which may play a role include bovine viral diarrhea, BVD, and infectious bovine rhinotracheitis viruses IBR, and Escherichia coli, or infestations with parasites such as Fasciola hepatica. In a series of experiments, clinical signs tended to be more severe in dual infections with BVD and Salmonella than with Salmonella alone, suggesting that BVD exacerbates the effects of Salmonella infection. The effects of these stress factors are probably related to the suppression of cell-mediated immunity. The most important sources of Salmonellas are clinically affected and carrier animals, and feces-contaminated environments, water and feedstuffs. Clinically affected animals excrete large numbers of bacteria, particularly in their feces. Scouring calves have been shown to excrete up to 10 billion organisms per gram of feces within 24 hours of infection, rising to 1,010 per gram after that. Apart from fecal excretion, organisms may also be excreted in the urine and the saliva, originating from the tonsils or salivary glands, of diseased calves, as well as in the milk of cows in which salmonellas have colonized the udder. Salmonellas can survive in colostrum stored at 5 to 11 degrees Celsius for more than 30 days. Adult cattle are important in the dissemination of salmonellas as they act as carriers, particularly of S. Dublin. Salmonella Dublin may be excreted in the milk, feces and urine of cows for up to 4 weeks after parturition or abortion. Persistent excretion of S. typhimurium DT104 in milk has been recorded in a dairy herd in the UK. Excretion of S. Newport for 11 months after a disease outbreak has also been documented. Clinically normal calves can occasionally act as carriers. Carrier animals harbor organisms in their mesenteric lymph nodes, gut-associated lymphoid tissue, macrophages in the lamina propria of the intestine, ruminal fluid, and the gallbladder. Stressed animals have greater numbers of organisms and shed them more readily and in higher numbers than non-stressed carriers. Calves are frequently infected, after the introduction of carrier animals from other properties or sale yards. Animals that graze with active carriers, animals that are fecal excretors of the organism may ingest and shed salmonellas in their feces and are referred to as passive carriers, as they stop excreting the bacteria when they are removed from the source of infection. Active carriers may excrete 1,000 to 100,000 organisms per gram of feces. Carriers that do not excrete salmonellas in their feces are referred to as latent carriers. Cattle carrying S. Dublin may either lose the infection or remain lifelong carriers, shedding organisms intermittently or continuously in large numbers in their feces. Parturition is probably an important event in the activation of latent carriers of S. Dublin, and this can lead to congenital infection of calves. The administration of dexamethasone to carrier animals can precipitate clinical signs, even to the extent of septicemia, and increased shedding of salmonellas. In contrast, cattle carrying S. typhimurium generally shed the bacteria for a limited period only, in most instances no longer than 3 to 4 months. Salmonellosis in calves can be self-limiting in 2 to 5 weeks. In addition to cattle, a wide range of other domestic and wild animals, particularly rodents and birds, may also be carriers of S. typhimurium and shed the organism into the environment. Rodents may also be reservoirs of S. Dublin. Apart from carrier or diseased animals, other sources of salmonella include animal feedstuffs whose constituents may be infected prior to formulation or become contaminated thereafter, poultry manure and litter, which are commonly used as a feed supplement for cattle and because of their high nitrogen content, and water contaminated by sewage. The practice of using effluent to irrigate pastures may disseminate the infection widely and expose large numbers of cattle to salmonellosis. Infections may be related to the level of contamination. The risk of infection in calves grazing pastures contaminated with slurry is considered to be low. Water sources, particularly in the vicinity of informal settlements with unsatisfactory sewage disposal facilities, may become contaminated with salmonellas, and can also widely disseminate the bacteria. The use of communal calf milk substitute dispensers can play a role in the spread of infection. The feeding of unpasteurized milk or milk from bulk tanks with contaminated milk line filters can also be sources of infection for calves. Veterinarians may aid in the dissemination of infection between farms. Salmonellas have been isolated from gumboots worn on infected properties, even after scrubbing in warm water and a quaternary ammonium disinfectant. The organisms can also be transmitted on the wheels of vehicles. Contamination of market premises and transport vehicles has been shown to play a role in the epidemiology of salmonella infection in calves. Concern has been expressed as to the possibility of nosocomial infections and the spread of salmonellas in veterinary teaching hospitals due to the movement of staff, students, clients and visitors. Salmonella organisms may survive in the environment for variable periods when suitable conditions of moisture and organic material are present. For example, Salmonella Dublin has been found to survive for 10 months to 6 years in feces splashed on stall surfaces, and for over 1 year in the environment, under a wide range of climatic conditions. Salmonella typhimurium, on the other hand, has been reported to persist in contaminated rearing premises, pastures and soil for between 4 months and 2 years. Most salmonella infections occur by the fecal-oral route. Aerosol transmission has been reported but is rare. Conjunctival infection of calves has been achieved experimentally. Calves may occasionally become infected transplacental. Intensive farming units with close contact between calves favor the transmission of salmonellas. The minimum oral dose of various serovars required to induce clinical enteric disease varies, the oral route requiring about 25% more bacteria than respiratory infection. The larger the challenge dose, the higher the morbidity and mortality rates, especially in younger calves. Survival is inversely related to the size of the challenge inoculum. Clearly, therefore, the larger the number of organisms in the environment, the more likely it is that a susceptible animal will contract salmonellosis. Salmonellosis is a zoonosis, S. typhimurium being more commonly involved than S. Dublin. The organisms can readily be transmitted from animals to humans by ingestion or inhalation. Animal-derived food, especially raw milk, meat and eggs, is the most important source of infection for people. The high fat content of milk protects the organisms from the acidic environment of the stomach, allowing them to pass through it unscathed. As an example of the potential impact of zoonotic infection, a single dairy cow will shed S. enteritis in milk continuously for several months and be responsible for a number of infections in people ingesting the raw milk from the bulk tank. Although the transmission of infection by direct contact between humans is uncommon, outbreaks can occur in hospitals and in family groups. People working with animals are at risk of contracting the disease, from carrier calves or adults, while the risk is even greater when treating clinically affected animals. Cutaneous infections of veterinary surgeons handling aborting animals is recognized as an occupational hazard. In contrast, humans excrete salmonella organisms and are a source of infection for animals. For example, calves may become infected when they are taught to drink milk from a bucket by attendants who are themselves infected. Salmonellas are facultative intracellular organisms, and survive in macrophage phagolysosomes where they are protected from the effects of antibody and complement. This is particularly important in latent carriers where the effects of stress, parturition, can induce the active shedding of organisms. The outcome of infection with Salmonella depends essentially on three factors: the size of infective dose, predisposing factors influencing the host, and the level of immunity. A feature of serovars more commonly associated with systemic infections S. is the presence of plasmid-encoded SBV genes which promote enhanced intracellular proliferation in intestinal tissues and at extraintestinal sites in the natural host. The SBV genes are found in nearly all natural isolates of Salmonella that are host-adapted to animals, but only a proportion of broad host-range serovars carry the genes. In bovine Salmonellosis, only the intestinal tract may be involved or, if the organisms manage to spread beyond the intestinal mucosa and mesenteric lymph nodes, septicemia or bacteremia may develop and result in dissemination particularly to the liver, tonsils, spleen, lungs and lymph nodes. A second bacteremia can follow with localization of salmonellas at sites such as the joints, meninges and placenta, especially the cotyledons. One or more active nutrients, present in placentomes, promote the growth of salmonellas. In this regard, erythritol, a factor responsible for the localization of Brucella abortus in the bovine uterus, has been eliminated. Pregnant animals may abort without evidence of enteric disease. Fetal death is due to septicemia and/or placentitis. Since premature live-infected calves can result, abortion in late pregnancy is probably not stimulated by fetal death, rather, hormonal changes resulting from the placentitis may be responsible. In closed herds, the primary clinical manifestation, such as pneumonia, abortion, enteritis or polyarthritis, of S. infections may differ from year to year. The pathogenesis of the enteric lesions has two stages: colonization and invasion of the intestine by the bacteria, followed by increased secretion of fluid and electrolytes. Colonization and invasion of the intestine. Salmonellas must be ingested in sufficient numbers for colonization of the distal small intestine and colon to occur. Factors which interfere with and disrupt the normal intestinal flora, such as antimicrobial therapy and food and water deprivation, may enhance colonization and temporary overgrowth by salmonellas, especially in the small intestine. Colonization tends to occur more readily in stressed animals. The ability of the bacteria to attach to and invade enterocytes is essential for the development of enteric salmonellosis. Following oral infection of calves, salmonella are recovered in high numbers from the distal ileum mucosa, within the first 72 hours of infection, suggesting that this is the main site of invasion. The possession of pili enables the bacteria to become attached to the surface of enterocytes, which facilitates their entrance into the cells through the brush border. The bacteria may also invade the mucosa through intercellular junctional complexes. Most salmonellas remain intact within membrane-bound vacuoles in the cytoplasm of enterocytes, where they multiply and produce enterotoxin. Although many bacteria may be present in a single enterocyte, during the early stages of infection, cellular damage is mild. After 24 hours of infection, most of the bacteria are located in membrane-bound vacuoles within macrophages and neutrophils in the lamina propria, from whence they may spread to the regional lymph nodes, in which further multiplication takes place. Stimulation of secretion of increased amounts of fluids and electrolytes. Enterotoxin and the inflammatory response that follows invasion of the intestinal mucosa by salmonellas and causes the release of prostaglandins that activate mucosal adenyl cyclase, resulting in a net secretion of water and electrolytes into the lumen of the intestine. Malabsorption and maldigestion will develop as a result of cellular infiltration in the affected intestine and damage to the villi, which restricts lymph and blood flow and diminishes the absorptive surface. In cattle, the enteric and septicemic syndromes of salmonellosis are more common than the abortion syndrome. One or more of the syndromes may occur simultaneously in an outbreak of salmonellosis in a herd, or even in a single affected animal. Salmonella Dublin is more often the cause of septicemia than S. typhimurium, and adult animals are less likely to suffer from septicemia. Calves may develop peracute, acute or chronic salmonellosis. The peracute disease is usually a septicemic condition. It is often fatal, and calves may die suddenly without being seen to be ill. Some, however, develop enteritis and diarrhea in addition to septicemia. When the course of the septicemia is protracted, signs of hepatitis, pneumonia, meningoencephalitis, polyarthritis and osteomyelitis may develop. Acute enteric salmonellosis is the most common syndrome of salmonellosis encountered in calves. Following an incubation period which may vary from 1 to 5 days, calves develop a high fever, inappetence, lethargy and depression, diarrhea, polypnea and frequently a serous nasal discharge followed by a slight cough. Scouring may only occur terminally. The feces of affected calves are foul-smelling, have a putty-like consistency and contain large amounts of mucus, sloughed mucosa and flecks of blood. These animals show signs of colic, become gradually weaker, are unthrifty and dehydrated and may collapse into sternal recumbency. At this time the body temperature may be normal or subnormal. Calves that die probably develop a terminal septicemia. The morbidity rate is generally much higher among purchased than home-bred calves, it may reach 75% but mortality rates are generally between 5 and 10%. Chronic salmonellosis in calves is characterized by unthriftiness, long and scruffy hair coats and stunting. Diarrhea is not always present and signs of chronic pneumonia with persistent coughing may occur. Calves that survive either per acute or chronic disease may develop pneumonia, meningoencephalitis, purulent polyarthritis, particularly of the carpal and tarsal joints, and osteomyelitis of the vertebrae and bones of the distal parts of the limbs, resulting in lameness, paresis or even almost complete paraplegia. Dry gangrene of the skin of the lower limbs, and the tips of the ears and tail, resembling ergotism, is rarely seen with S. Dublin infection. The affected parts are cold and sharply demarcated from the normal tissues. Adult cattle generally contract either acute or subacute enteric salmonellosis, and pregnant animals may abort. During the early stages of the acute enteric disease, severely affected animals show fever, depression, inappetence, and a drop in milk yield. These signs are followed by diarrhea which is foul-smelling, the feces being mucoid and usually containing clots of blood and shreds of necrotic intestinal mucosa. Signs of colic, congested mucous membranes and dehydration may be evident. The acute disease lasts for about a week. The case fatality rate in adult animals with dysentery is usually about 50%, but may be higher. Complete recovery may take up to 2 months. Similar but less severe signs are present in animals suffering from subacute enteric salmonellosis, and most affected animals recover without treatment. Salmonella Dublin in particular, but also S. typhimurium and other serovars, may cause abortion in cows at any stage of pregnancy. Abortions may either precede the onset of dysentery or follow it within 2 to 4 weeks. Alternatively, abortion may follow a period of pyrexia or it may be the only sign of ill health. Aborted fetuses generally show evidence of decomposition. Retention of the placenta occurs in approximately 70% of cows that abort, but subsequent fertility is not usually affected. Diarrhea is not always present and signs of chronic pneumonia with persistent coughing may occur. Calves that survive either per acute or chronic disease may develop pneumonia, meningoencephalitis, purulent polyarthritis, particularly of the carpal and tarsal joints, and osteomyelitis of the vertebrae and bones of the distal parts of the limbs, resulting in lameness, paresis or even almost complete paraplegia. Dry gangrene of the skin of the lower limbs, and the tips of the ears and tail, resembling ergotism, is rarely seen with S. Dublin infection. The affected parts are cold and sharply demarcated from the normal tissues. Lesions. Calves suffering from per-acute septicemic salmonellosis show a marked leukopenia, with a left shift. Metabolic acidosis may be present, even in the absence of diarrhea or dehydration. In calves with enteritis, leukopenia is present during the early stage, but those that survive for 3 to 4 days develop a leukocytosis and elevated plasma fibrinogen levels. During the initial stage of enteric disease, dehydration results in elevated packed cell volume and plasma protein levels, but plasma protein levels will drop after some time due to loss into the gastrointestinal tract. Diarrheic calves have decreased serum sodium and chloride levels, and serum potassium values may be either elevated or depressed, despite the tendency towards a metabolic acidosis. Blood urea levels can increase markedly, and may be of value in prognostication. Plasma bilirubin levels are raised in calves with cholestasis, possibly because of an interference in bilirubin excretion by bacterial metabolites. Calves that have died from peracute septicemic salmonellosis usually have widespread subcutaneous, mucosal and serosal petechial hemorrhages, generalized congestion, edema and congestion of the lungs, splenomegaly and hepatomegaly. The carcasses of calves that have died from the acute enteric disease reveal varying degrees of dehydration and in some cases mild icterus. There is moderate hepatomegaly, and the liver is bronze or orange-brown and often has a few to numerous grayish-white foci of necrosis, as well as a few petechiae disseminated throughout the parenchyma. In order to see the necrotic foci with the naked eye, it is often necessary to examine several cut surfaces of the liver very carefully in good light, sunlight being preferable. The gallbladder is distended, the wall is edematous and there may be focal necrosis of its mucosa or wall hemorrhages. The spleen is moderately enlarged and on-cut section may reveal inconspicuous necrotic foci in the red pulp, similar to those in the liver. Small areas of acute bronchopneumonia, sometimes accompanied by hemorrhages in the lung parenchyma and a fibrinous pleural exudate, and swelling of the kidneys with whitish-gray foci of necrosis, in the renal cortex may be evident in some animals. The lesions in the gastrointestinal tract vary in severity and location. In Salmonella Dublin, infections of the abomasum mucosa may have multiple erosions and petechiae. In most calves with salmonellosis, the jejunum and ileum are affected. Depending on the severity of the disease, catarrhal, necrotizing or diphtheritic jejunitis and ileitis may be present. In some animals, the cecum and colon show similar lesions to those in the small intestine. The contents of the intestine, particularly the affected parts, are watery, foul-smelling and usually contain copious amounts of an admixture of fibrin, mucus, desquamated mucosa and digested blood. The mesenteric lymph nodes are enlarged and edematous, and may reveal petechiae on cut surface. The carcasses of calves that have died from the chronic disease manifest many of the lesions present in the acute disease, although the large intestinal lesions are often more discrete and necrotic. In addition, there are frequently signs of localization of the infection in a variety of organs and tissues. These include fibrinopurulent synovitis of the larger joints, particularly of the limbs, fibrinopurulent bronchopneumonia and abscesses in the lungs, and occasionally meningoencephalitis, osteomyelitis of one or more of the vertebrae and bones of the limbs, and ischemic necrosis of the skin, of the tips of the ears, and the distal parts of the tail and limbs. The histopathological lesions in the liver comprise small foci of coagulative necrosis which are infiltrated by a few macrophages and mononuclear cells. These foci are present in the liver, and are referred to as typhoid nodules. They are randomly scattered in lobules throughout the liver, some of which are associated with thrombosis of central veins or blood vessels in portal triads. Other lesions include mild to moderate infiltration of mononuclear cells into most portal triads, vasculitis sometimes accompanied by thrombosis of the larger blood vessels in the triads, moderate Kupffer cell proliferation, clumps of gram-negative bacteria and sinusoids and bile stasis. Vascular lesions and necrotic foci, similar to those in the liver, are usually present in the spleen, and sometimes also in the lungs, lymph nodes, particularly the mesenteric lymph nodes, kidneys and bone marrow. The lesions in the affected parts of the intestines are characterized by necrosis and ulceration of the mucosa, presence of moderate numbers of mononuclear cells and neutrophils in the lamina propria and submucosa, and vasculitis and thrombosis of some of the blood vessels in the submucosa. Copious amounts of cellular debris, mucus and fibrin adhere to the necrotic mucosa or are present in the lumen of the affected parts of the intestines. Salmonellas may be observed microscopically as individual bacteria or colonies of organisms, associated with the areas of inflammation and necrosis. The macro and microscopic lesions of salmonellosis in adult cattle are similar to those in calves except that the enteritis is generally more hemorrhagic and fibrinous or necrotic. Cows with mammary infections may have a chronic active mastitis and supramammary lymphadenitis. A purulent endometritis and necrotic hepatic foci may be seen in cows that abort. The chorion is thickened, with the surface mottled red and gray, and cotyledons, which are tan or red, may be covered with a yellow exudate. The latter may contain remnants of maternal caruncle. Histologically, mineralization of areas of the placenta may be extensive, and some villi may contain large numbers of neutrophils. Many cotyledonary villi are necrotic and capillaries in the chorionic arcade contain prominent bacterial colonies. The cotyledons contain more bacteria than do caruncles. The fetal liver can have multiple foci of suppuration while the lungs are generally normal. Occasionally, however, neutrophils may be seen in the bronchi and bacteria may colonize the bronchial epithelium. The diagnosis of salmonellosis is based on the isolation of the causative organism, supported by the history, clinical signs and lesions at necropsy. Specimens submitted to the laboratory for salmonella isolation should be incubated in selective enrichment media to enhance the chances of isolating the organisms. In live animals with diarrhea, fecal specimens or rectal swabs should be submitted for bacterial isolation. In animals suffering from severe diarrhea, the large volume of feces may dilute the number of organisms in the feces to such an extent that rectal swabs contain insufficient organisms to enable successful isolation. Salmonellas may be isolated from the blood of septicemic animals. Apart from the examination of fecal specimens and rectal swabs, rectal mucosal biopsy provides an easy and safe method that increases the chance of isolating salmonella organisms, the reason being the adherent and invasive nature of salmonellas that results in their concentration on the mucosa. From dead animals, specimens of liver and spleen, one or more mesenteric lymph node, particularly the ileum and colon, and a section of the affected part of the intestine should be submitted at 4 degrees Celsius for bacterial isolation. In addition, specimens from the liver, spleen, kidneys, brain, lungs and intestine should be collected and placed in a 10% buffered formalin solution for histopathological examination. The presence of the typical necrotic foci and thrombosis, particularly in the liver and spleen, are highly suggestive of salmonellosis. The identification of carrier animals is not always easy, as such animals may shed bacteria intermittently and it may be necessary to examine specimens taken from them on a number of occasions before a positive culture is obtained. The identification of latent S. Dublin carriers is a major problem, as fecal culture and serology are usually negative. Since parturition may activate a latent infection, swabs of feces and vaginal discharges should be cultured. Where a latent infection is suspected in a dead animal, special attention should be paid to attempting to isolate salmonellas from the gallbladder, ileocecal lymph nodes, tonsils, female genital tract, supramammary lymph nodes and udder. Salmonellas can be isolated from the organs, liver, spleen, lungs, and abomasum contents of aborted fetuses. The placenta and vaginal mucus of cows that abort should also be submitted for bacterial isolation. Serological tests, such as ELISA, serum agglutination and complement fixation, are used for the retrospective diagnosis of salmonellosis or the detection of carriers. These tests are, however, rarely used for diagnostic purposes and are only reliable when applied on a herd or flock basis, or when both acute and convalescent phase sera are tested. Antibody responses are much higher in animals that have suffered systemic infections, bacteremia or septicemia. Many infected animals may not have positive titers, either because the serum was collected too early during the course of infection, less than 14 days, or because the infection was not severe enough to stimulate a detectable humoral immune response. Latently infected cattle remain serologically negative. ELISAs have been developed primarily for the detection of S. Dublin or S. typhimurium carriers but, due to cross-reacting O antigens, the specificity has been poor. More specific assays have been developed to identify S. Dublin carriers, using fimbrial antigens or serogroup-specific lipopolysaccharide. ELISAs have been used to detect antibodies in both blood and milk. Differential diagnosis. The clinical signs of enteric salmonellosis in calves are nonspecific and are very similar to those caused by many other infectious and non-infectious agents that affect the gastrointestinal tract. The most important of these include viruses, bacteria, protozoa and nutritional causes. The clinical signs and lesions of salmonellosis in calves may be very similar to those of Rift Valley fever. The diarrhea associated with enteric salmonellosis in adult cattle may be bloody or dysenteric and should be differentiated from that caused by BVD virus, arsenic poisoning, helminths, toxic plants and ingestion of the pollen beetle. Abortion caused by Salmonella serovars should be differentiated from that induced by other agents, the most important of these being Brucella abortus, Leptospira, Rift Valley fever virus, BVD viruses. Different approaches to the therapy of salmonellosis, particularly the enteric disease, have been reported. The use of antimicrobial drugs in the treatment of enteric salmonellosis, although controversial, may have beneficial effects, especially if applied during the early stages of the disease. Parenteral antimicrobial therapy has been shown to be more beneficial than oral treatment. Antimicrobial drugs have been shown to be effective in preventing the development of bacteremia or septicemia in animals suffering from enteric disease. They also prevent localization of salmonella in extraintestinal organs and the subsequent development of lesions. Antimicrobial drugs generally recommended for parenteral use are ampicillin, amoxicillin, gentamicin, trimethoprim sulfonamide combinations and fluoroquinolones. Salmonella Dublin is sensitive to most antimicrobials, although increasing antibiotic resistance in this serovar is being recognized. An antibiogram will be of help to the practitioner, because antimicrobial sensitivity may vary geographically. Resistance is higher in bacteria isolated from calves than in those isolated from adult cattle, which may be related to the increased use of antimicrobials in calves. The oral administration of antimicrobial drugs in cattle is a satisfactory method of treatment, but it must be used with caution. Some antimicrobial drugs, as neomycin, chloramphenicol, tetracycline and ampicillin, may cause signs of diarrhea due to malabsorption after 3 days of treatment. Disturbance of the gastrointestinal flora by the use of antimicrobial drugs and the presence of resistant salmonella may result in overgrowth of these organisms, and the conversion of an enteric infection into a septicemic form. Antimicrobial drugs administered orally may also increase colonization of the gut by other gram-negative bacteria, induce the development of multiple drug resistance, and prolong the carrier state. Antimicrobial therapy does not usually eliminate the carrier state in cattle. The number of animals that shed the organism and the duration and amount of shedding may be increased if the salmonella strain involved is resistant to the drug used. Chloramphenicol facilitates the persistence of salmonellas, particularly the antimicrobial-resistant serovars. It is generally agreed that supportive therapy and good nursing are important. These include oral or parenteral rehydration, correction of electrolyte imbalance and stabilization of the acid-base equilibrium. Symptomatic treatment with opioids, alpha-2 agonists, parasympatholytics and anti-inflammatory drugs may have a beneficial effect. Nonsteroidal anti-inflammatory drugs, such as flunixin meglumin, may be of benefit in cases with endotoxic shock and to block intestinal prostaglandin production. Most anti-inflammatory drugs are, however, potentially dangerous, especially in dehydrated animals. There is no consensus on the value of intestinal adsorbents and protectants, such as activated charcoal and kaolin, in animals affected by enteric disease. In programs designed to control salmonellosis, the measures described below should be applied. Measures aimed at protecting cattle. Risk factors over which the farmer can exert a level of control include purchasing replacement stock from direct sources rather than dealers, quarantine of purchased animals for a 4-week period, housing sick animals in dedicated isolation areas, preventing wild bird access to cattle feed stores, and vaccination. These measures are likely to have the greatest impact on the reduction of salmonellosis. Improving the resistance of animals in high-risk groups by immunization is important, as is correct feeding to maintain the intestinal flora in a balanced state. Separation of age groups and the prevention of contact with other infected carrier animals lessen the risk of exposure, while the isolation of diseased animals and the elimination of potential sources of infection prevent the spread of the infection and the contamination of the environment. Measures aimed at the agent. Treatment and isolation or elimination of animals suffering from salmonellosis, as well as disinfection of sheds and stables, should be implemented to prevent the buildup of environmental contamination. To eradicate S. Dublin from dairy herds, every effort needs to be made to detect carrier animals so that they can be culled. Salmonella bacteria are destroyed by most disinfectants that are effective against vegetative bacteria. Some specific disinfectants, as diethylpyrocarbonate and hydrogen peroxide, are recommended for use in feedstuff, but are generally too expensive to use as disinfectants for the external environment or fomites. Salmonella contaminated areas, such as stables, concrete areas, equipment and vehicles should be steam cleaned and then disinfected with phenolic, chlorine or iodine-based disinfectants. Yards with earthen flooring can be decontaminated with several successive sprayings of 5% formalin. Carcasses of infected animals should be burnt and should definitely not be rendered for animal feed. Slurry should preferably be used on crops, other than root crops, and not pastures intended for grazing. Silage making destroys salmonellas. Measures aimed at the environment. These include the institution and maintenance of hygiene and good animal husbandry practices, such as the regular removal of feces, keeping food stores rodent-free, the use of separate milk pails, which are thoroughly washed and disinfected after use, for each calf, provision of suitable housing, and the prevention of overcrowding. In order to break the cycle of infection, consideration should be given to an all-in all-out policy with thorough cleaning and disinfection between batches of calves. Any procedure likely to enhance aerosol transmission should be avoided. The use of vaccines is important to control salmonellosis in cattle, but immunization on its own is often insufficiently effective to be relied upon entirely, and other means of limiting the spread of infection also need to be implemented. Generally, both live-attenuated vaccines, produced from rough strains and bacterians precipitated on aluminum hydroxide are available commercially. A trivalent, formalin and activated bacterian prepared from isolates of Dublin, Typhimurium, and Bovis morbificans. A live, attenuated vaccine containing an avirulent rough mutant of Dublin. Live attenuated vaccines should be administered as a single inoculation to calves at 2 to 4 weeks of age. Antimicrobial drugs should not be administered to calves during the week prior to and for 2 weeks after immunization with live attenuated salmonella vaccines, as immunity is dependent upon the multiplication of the bacteria contained in the vaccine. Bacterians, to be effective, need to be administered twice at an interval of 2 to 4 weeks but are usually ineffective in calves under 6 weeks of age. For this reason, the administration of bacterians to pregnant cows is sometimes recommended in order to provide their calves with colostrum immunity, which persists at protective levels for approximately 6 weeks. On farms on which calf salmonellosis is a particular problem, calves whose dams were immunized with a bacterium during pregnancy should be immunized at 6 weeks of age with a live attenuated vaccine against Dublin. In this way it is usually possible to ensure that these calves have an adequate level of immunity during the danger period. Ovine and caprine salmonellosis. Salmonella serovar infections in sheep and goats are manifested by the development of 2 distinct syndromes, an acute to subacute septicemic disease, associated with diarrhea, and abortion. The septicemic syndrome is most frequently caused by Typhimurium and is precipitated by stress. It is characterized by the development of a watery green to blood-tinged diarrhea, the consequence of a severe necrohemorrhagic ileitis, typhlitis and colitis. Although the septicemic disease in sheep is less prevalent than bovine salmonellosis, its occurrence and economic importance appear to be increasing with the development of the sheep feedlot industry. In the UK, Australia and Canada, Salmonella abortus ovis, Dublin, Typhimurium, Montevideo, and Arizonae infections have been incriminated as causes of abortion in sheep. More recently, Brandenburg has also been reported as a cause of large-scale abortions in sheep in New Zealand. Etiology. Salmonella typhimurium is most frequently isolated from sheep in Africa while Dublin, enteritis and others are only rarely encountered. Isolations of Salmonella from sheep in the UK from 1991 to 1997 showed that Typhimurium, followed by Montevideo, Derby, and Dublin, were most commonly found. In New Zealand, Hindmarsh is the most commonly isolated serovar from enteric disease in Brandenburg, from cases of abortion. Epidemiology. Salmonellosis in sheep and goats occurs under both intensive and extensive farming conditions. Sheep of all age groups are susceptible, but 2 to 4-toothed sheep are most commonly affected when they are marketed from pasture and consigned to abattoirs or feedlots. Typhimurium and Ondrastoport infections of sheep were first reported often been associated with mortality in sheep which have been railed over long distances. Salmonellosis is also reported as a major cause of losses to the sheep export industry of Australia during large-scale shipment to the Middle East. With few exceptions, there is therefore a history of preceding transport lasting several hours. Most outbreaks of the disease occur within 1 to 4 weeks of the introduction of sheep from pastoral grazing into feedlots, where diets comprising high proportions of grain and insufficient amounts of roughage are fed. Other nutritional practices, such as a too rapid change to finishing rations with a high non-protein nitrogen content which favors the proliferation of salmonellas in the digestive tract. The disease also occurs under pastoral grazing conditions after sheep have been crowded during dipping and shearing. The source of infection in outbreaks is often obscure. It can sometimes be traced back to animals that have been exposed to poor hygienic conditions along the course of transit. Heavy contamination of holding pens, road or railway vehicles, water troughs, abattoir or feedlot yards, dams and streams by salmonella-infected feces of carrier animals and birds has been reported. In New Zealand, abortions caused by Brandenburg have occurred on the South Island since 1996. Spread of the agent between regions was due to transporting animals from drought-affected areas. In a large outbreak in 1998 involving 130 farms, seagulls scavenging on the products of abortion were believed to have contributed to the spread of Salmonella Brandenburg between farms. Salmonella typhimurium has been shown to survive for at least 251 days in soil and for 168 days on pastures. Under field conditions, infection by the oral route is the most important, but sheep may also become infected by the nasal route. Salmonella abortuosus has been isolated from the male genital tract on several occasions. Venereal transmission has only been demonstrated experimentally. Stress-inducing factors, such as mobbing, starvation, and a high saline content of drinking water have been associated with abortions due to Dublin and typhimurium. In one study, abortions in twin and triplet-bearing ewes were more common due to Brandenburg infection than in ewes bearing single lambs, and poor weather appeared to increase the number of daily abortions during the outbreak. Sheep, and possibly goats, may excrete Salmonella serovars in their feces intermittently. However, in contrast to infected cattle, which may excrete Salmonella serovars in their feces for 12 months, or even indefinitely, sheep have not been found to excrete typhimurium for longer than 30 days after oral infection, and therefore do not appear to become carriers after this route of infection. Longer periods of fecal excretion have been observed after intravenous and intranasal infections. Vaginal discharges or products of abortion may also contaminate the environment. Infected cattle, which excrete salmonellas in their feces for relatively longer periods, salmonella-contaminated animal products used for feed, such as blood, carcass and bone meal, and poultry litter, serve as additional sources of infection for sheep. The pathogenesis of systemic infections of typhimurium in sheep and goats is similar to that of experimental typhimurium infections in rabbits, pigs and calves, and to Dublin and enteritis infection in calves. Natural infection of sheep and goats with enteritis or abortion is probably by the oral route and probably develops similarly to experimental infections with typhimurium, Montevideo, and Dublin. Following ingestion, organisms usually invade the intestinal mucosa, and multiply in the gut-associated lymphoid tissue, from where they are drained to the regional lymph nodes, which represent a first line of defense. If the lymphoid tissue succeeds to contain the spread of organisms effectively, the infection remains localized to the intestine, where it often causes an acute enteritis with diarrhea. If the macrophages in the draining lymph nodes fail to control the spread of organisms, Salmonella serovars can cause a systemic disease. The outcome of infection is usually determined by the interactions between plasmid-associated genetic virulence factors and the host defense or immune system. The virulence of certain typhimurium, Dublin and enteritis strains in mice appears to be plasmid and gene-mediated. Salmonellas also possess flagella which prolong their survival in macrophages. The lipopolysaccharide component of the endotoxin contained in the outer cell wall of the bacteria contributes to many aspects of the pathogenesis of salmonellosis. Invasiveness, and survival time of Salmonella typhimurium in the animal, among other factors, have been related to the structure of the O-side chain of the lipopolysaccharide. It also triggers the release of mediators of acute inflammation, such as interleukin-1 and prostaglandins, and the clotting cascade. Endotoxic shock, characterized by pulmonary hypertension, prolonged systemic hypotension and decreased perfusion of vital organs, appear to be mediated by prostaglandins. Acute enteritis, initially affecting the duodenum, develops within 24 hours of infection. By 3 to 8 days after infection, a severe acute typhlitis and colitis occur, with the presence of blood-stained mucus and fluid in the intestinal lumen, and lymphadenitis of the mesenteric lymph nodes. Most lambs manifest a multifocal, necrotic hepatitis and nephrosis by the 6th day. Many lambs also exhibit a mild, interstitial pneumonia which bears some resemblance to the endotoxin-mediated lung lesions evoked by the experimental intravenous infusion of endotoxin. Penetration of the intestinal mucosa by bacteria, and the consequent inflammatory process, promote the development of diarrhea. Entrance of the salmonellas into the circulation may lead to septicemia, coagulopathy and circulatory shock accompanied by lactic acidosis. The effects of diarrhea and dehydration aggravate these hemodynamic disturbances, thereby causing organ failure and death. Virulence factors contained by the bacteria, which promote diarrhea, include adhesion pili, and cyto and enterotoxins, which cause increased permeability and increased secretion by mucosal epithelial cells, respectively. The virulence factors involved in the abortion syndrome are not well defined, but abortions involving Brandenburg and abortusovis in New Zealand have been caused by a clonal strain of the organism with marked tropism for the pregnant uterus. The frequency of abortion appears to be influenced by the stage of experimental infection, ewes being infected by abortusovis, typhimurium and Dublin during pregnancy, aborting more often than ewes infected by the same organisms before pregnancy. Clinical signs. The incubation period varies from 1 to 7 days in experimentally induced cases, but the natural disease usually manifests from 6 to 30 days, after the animals have been exposed to any one or more of the predisposing stress factors. Under field conditions, morbidity and mortality rates of 2 to 50% have been reported. Affected sheep usually have a fever of 40 degrees Celsius or higher, and show loss of appetite, listlessness, weakness, disinclination to move, a watery green to blood-tinged diarrhea, and soiling of the perineum. Severely affected animals become recumbent and usually die within 7 days. Sheep that survive for more than 7 days are often severely dehydrated, lose weight, and stand with arched backs and tucked-up bellies. Affected animals may recover and regain their normal body weight within 3 to 4 weeks. Clinical signs associated with the abortion syndrome vary to some extent according to the serovar of Salmonella involved and the stage of pregnancy. About 10% of ewes which become infected with S. abortusovis, S. Dublin, S. Brandenburg or S. typhimurium, may abort or give birth to stillborn or diseased lambs. Ewes that abort as a result of S. Dublin, S. typhimurium or S. Brandenburg infection usually become more severely affected and may die. The remaining animals usually show lethargy, inappetence, a purulent vaginal discharge, retained placenta, a break in the wool, and diarrhea. Aborted fetuses due to infection with S. Dublin are often in an advanced state of decomposition when expelled. Ewes which abort due to S. abortusovis infection rarely show signs of illness except for a small percentage that succumb to metritis as a result of secondary infections. Lesions. Depending on the course of the disease, the condition of affected sheep or goats varies from poor to good. Acutely affected animals usually show generalized congestion, variable degrees of petechial and ecchymosis, pulmonary edema, hepatomegaly, splenomegaly, focal necrosis in the mucosa of the gallbladder, and sparse and poorly mixed rumen contents. Congestion and hemorrhage of the mucosa of abomasum and the small intestine, a fibrinous to necrohemorrhagic ileitis, typhlitis and colitis occur. Enlargement and edema of the mesenteric lymph nodes are usually present. The contents, particularly of the distal parts of the small intestine and the entire large intestine, are very watery and foul-smelling. Subacute to chronic cases may show mucosal hyperplasia with nodular thickening in severe cases, especially in the cecum and colon. Microscopically, acute lesions are usually characterized by congestion, edema, hemorrhage, degeneration and necrosis of the affected part of the intestinal mucosa, and infiltration mainly of neutrophils but also of lymphocytes, plasma cells and macrophages into the lamina propria and submucosa. Fibrin thrombi may be present in submucosa. Acute septicemic cases may also show widespread disseminated intravascular coagulation in other major organs. Use that abort may reveal necropurulent metritis, blood-tinged pleural and peritoneal transudates, hemorrhagic enterocolitis and swollen, edematous mesenteric lymph nodes. Aborted fetuses and membranes usually show minimal decomposition and no specific pathological changes. Microscopical changes within the placenta are characterized by necrosis with desquamation of epithelium in the atlantochorion as well as infiltration of leukocytes and bacterial emboli. Infected lambs that die shortly after birth may present with pneumonia, gastroenteritis, enlarged mesenteric lymph nodes, and a clear to hemorrhagic, ventral, subcutaneous edema, fibrinous peritonitis, arthritis, and foci of necrosis in the liver. Salmonellosis should be suspected in sheep or goats that develop fever, severe diarrhea, and a necrohemorrhagic ileitis, typhlitis and colitis of sudden onset following transportation or recent introduction into feedlots. In live animals, a diagnosis of salmonellosis is confirmed by the isolation of the bacteria from the feces or from blood collected during the febrile phase of the disease. In animals that have died of the acute disease, salmonellas can be isolated from the liver, spleen, lungs and mesenteric lymph nodes regional to the affected parts of the intestinal tract. Samples for abortion investigation should include fetal liver or stomach contents, fetal membranes and uterine tissue from dead ewes. The detection of subclinical infections in individual sheep may constitute a problem as shedding of the bacteria in the feces may be intermittent. The isolation of Salmonella serovars on a flock basis is, therefore, generally more successful. For the recovery of the bacteria from carriers after they have been slaughtered, cultures should be made of the gastrointestinal tract and its regional lymph nodes. The methodology, laboratory isolation, and cultural procedures have been described in the introduction to Salmonella spp. Infections. It must be remembered that exposure to heat, freezing or disinfectants reduces the viability of Salmonella serovars. It is important to use non-inhibitory enrichment media, or to add a factor, such as yeast extract, when frozen specimens are examined. Prolonged incubation is recommended for blood and bone marrow cultures. Serology has limited value in the detection of previous infections. Infectious and non-infectious diseases which cause enteritis and diarrhea should be distinguished from ovine and caprine salmonellosis. In newborn and pre-weaned lambs, the most important conditions include colobacillosis due to enterotoxigenic strains of Escherichia coli, lamb dysentery caused by Clostridium perfringens type B, rota and coronavirus infections and coccidiosis. In weaned animals, yersiniosis caused by either Yersinia and Trocholitico or Y. Pseudotuberculosis is indistinguishable clinically from enteric salmonellosis. The diagnosis in each case should be confirmed by the isolation or identification of the causative agent from feces and/or tissue specimens. Plant poisonings and intoxications by the mycotoxins may also be confused clinically with salmonellosis. A number of other diseases, such as Q fever, chlamydiosis, toxoplasmosis, Rift Valley fever disease, campylobacteriosis, yersiniosis and listeriosis cause abortion and neonatal death and should be considered in the differential diagnosis of ovine abortion caused by Salmonella serovars. Therapy with combinations of trimethoprim and sulfadiazine, or with members of the aminoglycoside group, such as gentamicin and neomycin, may be of value in reducing mortalities during an outbreak of salmonellosis in sheep. Oral treatment can affect clinical cure, but may cause rumen dysfunction. It is, however, doubtful whether antimicrobial therapy can eliminate salmonellas from the digestive tract of recovered animals, in order to stop their excretion in the feces. The performance of an antibiogram on isolates of salmonellas is imperative, in order to formulate a strategy for the most effective form of antimicrobial treatment, because drug-resistant strains of salmonellas have become an obstacle in the effective chemotherapy of the disease. These strains may infect humans via food. Such resistance can also be transferred to other Enterobacteriaceae in both in vitro and in vivo situations. Antimicrobial therapy is not always beneficial in the treatment of salmonellosis and other gram-negative bacterial infections, since destruction of these bacteria may result in the liberation of highly toxic lipopolysaccharides, which are then responsible for the endotoxin-mediated effects associated with them. Early treatment with cyclooxygenase inhibitors, such as indomethacin, aspirin and flunixin meglamine, counteract the detrimental effects of endotoxin. Immunotherapy with polyvalent anti-lipopolysaccharide hyperimmune serum is a highly effective adjunct in the treatment of endotoxin-mediated diseases. Appropriate electrolyte and acid-base solutions should be administered. Digestive disturbances should be corrected. The crutch and tail should be washed with an insecticidal solution to prevent blowfly strike due to fecal soiling of these areas. The control of salmonellosis in sheep and goats is performed by the elimination or minimization of the predisposing stress factors. Where possible, sheep should be well fed on a good quality roughage, such as lucerne hay, in holding pens before they are subjected to a long journey. After the introduction of animals to a feedlot, their dietary program should provide roughage of good quality, while the amount of concentrates fed should be gradually increased over a period. Scrupulous hygienic measures should be applied in transport vehicles, abattoir lairages, feedlots, or wherever the congregation or temporary starvation of sheep is expected to occur. An all-in-all-out policy with sufficient time for cleaning and disinfection between different batches of sheep may be an advantage in feedlots. The isolation of scouring or moribund animals is imperative, and the carcasses of dead sheep should either be incinerated or deeply buried to prevent contamination of the environment and attraction of scavenging animals. Feedstuffs of animal origin and organic fertilizers should be carefully screened in order to determine that they have not been contaminated with salmonellas as a result of ineffective processing or following recontamination during storage. The use of a killed vaccine consisting of a combination of S. typhimurium, S. hindmarsh, and S. bovis morbificans, administered twice at an interval of 4 to 6 weeks, with the second vaccination given at least 2 weeks before the period of challenge, has been found to reduce mortalities due to salmonellosis in sheep on pastures. Vaccination in the face of an outbreak is widely used and is believed to offer some protection in previously unvaccinated animals. Favorable results have also been obtained after vaccination of lambs twice at an interval of 14 days with the vaccine containing S. typhimurium, S. Dublin, and S. bovis morbificans. Although live vaccines are more immunogenic, there is the potential risk of dissemination of the attenuated bacteria following their excretion in feces or by contamination of meat and other foods. Infection of pigs with certain serovars of Salmonella results in clinical disease with important consequences for pig production. Pigs can also act as reservoirs for a wide variety of Salmonellas with zoonotic potential, leading to their introduction into the human food chain. Porcine salmonellosis usually manifests as septicemia or enterocolitis in weaned pigs, and can result in serious production losses. Salmonella was first isolated from diseased pigs in 1886 by Salmon and Smith. The pigs proved to be suffering from classical swine fever, hog cholera, and it was only when that disease was eradicated from the USA that it was recognized that the bacterium isolated, named Salmonella Gallinarum, was capable of causing septicemia in pigs. Enterocolitis caused by S. typhimurium is also well known in pigs, and at present is the most common form of porcine salmonellosis in pigs in Europe, while S. Gallinarum remains an important cause of disease. The source of this pig-associated salmonella infection is unknown, but its occurrence demonstrates the unpredictability of outbreaks and emphasizes the need for laboratory examination of suspect cases. Salmonellas are commonly isolated from both healthy and diseased pigs, and, unless associated with characteristic clinical signs and lesions, are unlikely to be significant to the health of the pig. However, outbreaks of human salmonellosis have been traced to pork products. Most cases of porcine salmonellosis have been associated with S. Gallinarum or S. typhimurium. Salmonella Gallinarum is associated mainly with septicemia, but pneumonia also occurs as a separate entity. Meningoencephalitis may occur in a limited number of cases. Infection with S. typhimurium usually presents as enterocolitis, and rectal strictures, generally as a complication of colitis, have been reported and experimentally confirmed. Outbreaks of disease caused by S. typhimurium have been reported in Europe, Asia, and the USA. Salmonella Dublin and S. enteritis have been reported from cases of meningitis in suckling pigs. Numerous serovars have been isolated from healthy pigs. Epidemiology. Salmonellas are ubiquitous organisms that have been isolated from virtually every species of vertebrate from which culture has been attempted. They are also relatively resistant in the environment, which may consequently remain contaminated for long periods, although they are susceptible to heat, sunlight, and certain disinfectants. Porcine salmonellosis usually occurs in pigs maintained in intensive management systems. Given the wide range of potential hosts for at least Salmonella typhimurium, there is no reason why pigs kept under extensive conditions should not be affected, and it is likely that in many countries the disease in smaller herds is simply not reported. Salmonella Gallinarum usually affects pigs from weaning to 5 months of age, but sometimes adults as well. Suckling piglets rarely develop salmonellosis, possibly due to protection afforded by colostrum antibodies. They may, however, become infected. Disease usually does not appear before weaning. Enterocolitis caused by Salmonella typhimurium occurs almost exclusively in weaners, but neonatal piglets orally infected with Salmonella typhimurium may develop disease similar to that observed in weaners. Once pigs become clinically ill, they shed large numbers of salmonellas. Infection probably occurs most frequently by the direct fecal-oral route, but aerosol and dust-borne infections, and mechanical spread via contaminated equipment, clothing and boots probably play important roles. Salmonella Gallinarum is adapted to pigs and is not commonly isolated from other sources. There is evidence that, if the breeding herd is infected, most pigs in the piggery become infected. Experimental induction of the disease requires the administration of large numbers of the organism. One introduction of Gallinarum into a herd is usually by carrier pigs. Since many pigs exposed to infection do not become carriers, it appears that only a small proportion of pigs is responsible for the maintenance of the organism. Salmonella typhimurium has a much wider host range, and pigs may become infected due to contact with a wide variety of species, including birds, rodents, cats, dogs, cattle and insects, although infected pigs are probably the most usual source of infection. The existence of a carrier state of salmonellas is well documented. Shedding of the organism by carriers is sporadic and probably induced by stress. Mixing of pigs of different ages and/or from different sources, transport, crowding, and either immediate slaughter or prolonged holding periods in abattoir lairages are apt to induce massive shedding of salmonellas. Environmental factors, such as poor ventilation and sanitation, as well as poor nutrition, infection with other diseases and parasites, and managemental practices, as continuous flow production that permit a buildup of pathogens, predispose to salmonellosis. The identification of individual carriers is difficult. Because fecal shedding is sporadic, the bacteriological examination of individual feces samples is not a reliable indicator of herd infection, and repeated negative sampling may fail to reveal carriers. To detect infected herds, the examination of pooled samples of feces has been found to be effective, and superior to the use of rectal swabs for this purpose. Tonsillar swab or buffy coat culture may provide a more reliable method of detecting carriers. Studies show that the results obtained from serology are variable. Within groups of pigs, there was evidence that pigs shedding salmonellas had on average higher antibody titers than those of non-shedders, but absolute values were revealed above which shedding might have been expected. The epidemiology of human salmonellosis caused by salmonella-contaminated pig carcasses and pork products derived from them is complex. Numerous serovars have been isolated from pigs that have shown no evidence of disease. Since outbreaks of human disease have been associated with pork products, it is assumed that the slaughter of pigs infected with salmonellas may constitute a source of infection for humans. Even if pigs are not shedding salmonellas at the time of slaughter, handling of their carcasses may result in contamination of the meat from the gut or lymph nodes. The source of infection of pigs by nonspecific serovars is largely unknown. Contamination of their feed with salmonellas is a potential source of infection, but there is little evidence that the serovars identified in feed actually infect pigs. However, it is recommended that efforts should be made to reduce the prevalence and numbers of salmonellas in pig feed, which can act as a source of infection for birds and rodents as well as pigs, and pose a threat to human health whether or not they infect the pigs. Effluent from piggeries has been shown to be contaminated with salmonellas, and although dilution probably reduces the danger of recontamination of pigs, it has been suggested that using recycled wastewater may promote infection. Contact with feces is the most important source of infection of pigs, and feces flushed through open flush gutter systems are a more likely source of salmonella infection than the water used. Oral infection with salmonellas, results in multiplication of the organisms in the intestine, and invasion of the intestinal mucosa, followed by multiplication in the gut-associated lymphoid tissue. Intranasal inoculation of typhimurium in pigs that have been subjected to esophagotomy has demonstrated that disease may develop in the absence of colonization of the gut. The lungs are also a site of initial multiplication in pigs, naturally infected with Salmonellosis. Subsequent disease will depend on the number of infecting organisms, the virulence of the serovar, and the efficacy of the host's immune system to limit penetration and multiplication. Restriction of the infection to the intestinal tract and associated lymph nodes results in enterocolitis, which initially manifests clinically as a watery diarrhea due to hypersecretion, and may progress to more serious diarrhea as a result of mucosal damage. When the barrier to penetration beyond the intestinal tract fails, as is frequently the case in Salmonellosis infections, spread to many organs results. Infection via the aerosol route results in localization in the lungs, and can also lead to generalized disease or enterocolitis. Numerous virulence factors have been identified. Some of the factors that are likely to contribute to porcine salmonellosis are flagella and adhesins, cytotoxins, heat shock proteins, and lipopolysaccharide, endotoxin. Septicemic effects are due to widespread inflammation in many organs, with release of cytokines and other bacterial toxins, including endotoxin, which is responsible for vascular damage and thrombosis that characterize terminal cases of septicemic salmonellosis. Damage of pulmonary tissue is believed to be due to the release of bacterial toxins rather than invasion of pneumocytes by bacteria. The role of enterotoxin in typhimurium-induced diarrhea has not been defined. Salmonella typhimurium infection, as with cholera toxin, results in the activation of 5-hydroxytryptamine and prostaglandins E2. It is uncertain whether the reaction is caused by enterotoxin or by inflammatory mediators, because the influx of neutrophils into the mucosa appears to be necessary for the increase in fluid that results in diarrhea, which is not the case with cholera toxin. Neutrophils appear early in infection and are rapidly superseded by macrophages. Rectal strictures as a complication of typhimurium enterocolitis are believed to result from salmonella-induced ischemic proctitis, as the lesion occurs at the mucocutaneous junction, a region with a relatively poor blood supply. Clinical signs are determined by the serovar as well as by the route and severity of infection. Signs of disease may appear as soon as 24 hours, but usually 36 to 48 hours, after infection. On the other hand, pigs infected at an early age may evince signs of disease only at weaning. Early signs of S. Salmonellosis-induced septicemia are usually associated with fever, and may include reduced activity and feed intake, huddling together, and flushing or cyanosis of the skin, particularly of the ventral parts of the body and extremities. Some pigs may die without showing clinical signs of disease. Signs of pneumonia develop in a high percentage of cases, evidenced by dyspnea and coughing. A proportion of pigs that survive longer develop yellowish to greenish watery diarrhea. Neurological signs resulting from inflammatory processes in the central nervous system are commonly observed in a small percentage of affected pigs. In most cases mortality is high, and morbidity variable, usually less than 10%. Pregnant sows may abort. Recovered pigs may suffer relapses, or may become permanently stunted and unthrifty, in some cases progressing to cachexia and death. Enterocolitis, either as a result of infection with S. typhimurium or as a manifestation of S. Salmonellosis infection, is usually characterized by profuse, watery, yellowish to greenish diarrhea. Sudden death after diarrhea and vomiting has been described in 9-week-old pigs infected with S. typhimurium DT104, but mortality is usually low and those that do die do so as a result of dehydration. Pigs that develop rectal strictures after recovery from S. typhimurium enterocolitis generally demonstrate marked emaciation and growth retardation, rough hair coat and intermittent passage of watery, dark feces. Abdominal bloating is frequently present. Salmonella Gallinarum has been identified as a cause of porcine pneumonia, which may occur without the other usual manifestations of salmonellosis, presumably when infection occurs via the nasal route. Salmonella infections are reported to be the second most common cause of porcine bacterial pneumonia in pigs during the nursery and grower period, and noted that it is a common sequel of the disease porcine reproductive and respiratory disease syndrome. Clinical signs in these cases are restricted to the respiratory tract, possibly accompanied by fever and inappetence. The lesions of the different syndromes of salmonellosis are not pathognomonic. The condition of pigs varies from good in cases of acute disease to poor, stunted and even cachexic when disease has become chronic. Lesions of septicemic salmonellosis include cyanosis of especially the head, ears and tail, fibrin strands on serosal surfaces, and fluid accumulation in body cavities. The carcass is generally congested, and contains varying numbers of petechiae and ecchymosis. Petechiae are usually present in the kidney cortices, and variably in other organs and tissues. Organs, in particular the spleen, liver and lymph nodes, are swollen. Scattered pinpoint foci of necrosis may be visible in the liver. Varying degrees of colitis and typhlocholitis, from reddening to frank necrosis of the mucosa, with pseudomembrane formation and ulceration, may be present. Intestinal contents are usually scant in fluid. The presence of ulcers is suggestive for salmonellosis, although the button ulcers in the ileum, cecum and colon that have been described are not present in the majority of cases. Intestinal lesions in Salmonella-induced enterocolitis in the absence of septicemia vary from mild hyperemia of the mucosa of the small and large intestine to necrotic or pseudomembranous enterocolitis. Ulceration is reported not to be a feature of enterocolitis induced by S. typhimurium, but this organism has been isolated from intestinal ulcers in young weaner pigs. Other lesions of S. typhimurious infection included necrotic tonsillitis, lymphadenitis of the lymph nodes of the head region, and caseous pneumonia. Pneumonic lesions may vary from acute interstitial pneumonia with severe edema and varying degrees of hemorrhage, from petechiae to extensive ecchymosis, to serofibrinous or fibrinous bronchopneumonia with or without pleuritis. Macroscopic lesions in the brain and spinal cord, when present, are usually restricted to the presence of scattered petechiae. Rectal strictures, a sequence of chronic proctitis, consist of an annular band of fibrous tissue anterior to the rectal mucocutaneous junction that narrows but does not completely occlude the rectal passage. Cranial to the stricture, the colon is dilated, with the mucosa ulcerated, covered by a greenish pseudomembrane and filled with gas and pasty ingesta. The lesion is frequently accompanied by fibrinous peritonitis and atrophy of abdominal organs. Histopathological changes in septicemic animals include hyperplasia of macrophages including Kupffer cells in the liver, multifocal hepatic necrosis with microabscessation or microgranulomas, acute and sometimes suppurative glomerulonephritis, multisystemic necrotic vasculitis and thrombosis, accumulation of macrophages in bronchiole and alveoli of the lungs, and purulent to necrotic enteritis, with macrophages predominating except in the very early stages. Necrosis and ulceration of the intestinal mucosa are generally accompanied by thrombosis. Lesions in the nervous system, when present, usually consist of granulomatous meningoencephalitis, sometimes accompanied by microabscesses. The diagnosis of salmonellosis requires the isolation and identification of the Salmonella serovar in combination with a clinical syndrome and pathological lesions typical of the condition. It must be emphasized that isolation or detection of salmonellas does not constitute a diagnosis in itself, although the result may be of zoonotic significance. Bacteriological culture by conventional methods of spleen, liver, kidneys, lungs and intestinal content samples from carcasses, and feces from clinical cases, should result in a diagnosis. Serological typing of the isolated salmonella is necessary to determine the serovar involved. It has been suggested that failure to culture salmonellas by conventional methods, with the need to resort to special procedures, indicates that the disease was not salmonellosis. However, conventional approaches might not lead to the isolation of S. typhimurius, and more sensitive techniques, such as conventional and delayed enrichment, may also be required to reveal carriers of this and other serovars. Currently, more rapid methods of detection, in particular the polymerase chain reaction, permit early detection of salmonellas. A multiplex PCR that detects salmonellas as well as Lawsonia intracellularis is widely available. This test, when applied to fecal samples, will detect only pigs that are actually shedding organisms at the time of sampling. Because of its high sensitivity, detection of salmonella by PCR indicates that the sample was infected, but not that the animal was suffering from salmonellosis. Confirmation of salmonellosis by pathological examination, especially histopathological, is essential, unless the objective is simply to determine whether the pig harbored salmonellas. An ELISA is used to detect antibodies in serum. While this assay is useful for screening herds for previous exposure, serologically positive pigs are not necessarily carriers of the disease. There are currently no reliable tests available to detect carriers. Differential diagnosis. The clinical appearance and gross pathology of septicemic salmonellosis is similar to that of classical and African swine fever. Morbidity is generally lower than in African swine fever, and, unlike that disease, a particular age group is targeted, and the mortality rate is much lower. There are marked differences in the microscopic pathology of the swine fevers. Widespread chorirexis of lymphocytes is not a feature of salmonellosis. Other bacterial septicemias such as pasteurellosis and erysipelas may have a similar presentation, and should be distinguished by bacteriological and histopathological examination. Enterocolitis caused by S. typhimurium is likely to have features in common with most causes of diarrhea in pigs, of which the most important are Escherichia coli infections, swine dysentery, and proliferative enteritis caused by Lawsonia intracellularis. Salmonella typhimurium mainly affects the hindgut, unlike E. coli and L. intracellularis. When there is ileal involvement, the ileal lesions are less severe than those at and posterior to the ileocecal junction. The clinical features of enterocolytic salmonellosis differ from those of swine dysentery in that the pigs are ill and inappetent and the feces are fluid and yellow with blood appearing later rather than earlier in the course of the disease, while pigs suffering from swine dysentery usually appear healthy, although producing pasty, often blood-stained feces. Necrotic ileitis caused by salmonellosis is easily distinguished histopathological from that caused by L. intracellularis, which is characterized by proliferation and necrosis of mucosal glands, with loss of mucous cells, and the presence of large numbers of characteristic intracellular bacteria that are visible with silver staining. Gland necrosis is also a feature of salmonellosis, but the lesions are generally more severe, and are accompanied by thrombosis. Control of salmonella infection in pig herds is difficult. To date, success with vaccination using bacterians and subunit vaccines has been variable, and the use of these vaccines should form part of a holistic approach to control based on hygienic management. Promising results have been reported with live attenuated strains, but these are not widely available commercially. Antimicrobial treatment during outbreaks is rarely efficacious, although reduction in volume and duration of bacterial shedding have been demonstrated. The antimicrobial selected for use should be based on the results of an antibiogram of the Salmonella serovar isolated from atypical cases of the disease, as multiple resistance has been demonstrated for many serovars, including strains commonly isolated from pigs. Salmonella typhimurium DT104 strains are usually resistant to ampicillin, chloramphenicol, streptomycin, sulfonamides and tetracycline, and a low proportion has also been found to be resistant to trimethoprim and ciprofloxacin. 38 The propensity of some strains to develop multiple resistance has given rise to serious concerns, particularly about the prophylactic use of antimicrobials administered at lower dosage levels in feed. The inclusion of antimicrobials in the feed of pigs is not generally regarded as a sustainable method of controlling salmonellosis, although it may prevent clinical disease from developing. Hygienic measures are extremely important, as it has been demonstrated that infection in finisher pigs is more likely to be due to exposure to contamination during the growing period than to infection from the breed or herd. 8 While salmonellosis is considered to be more likely to occur in continuous flow management systems, the results of some studies suggest that all-in all-out management does not necessarily prevent salmonella infection. However, elimination of infection has been achieved by strategic movement of pigs to clean facilities, as well as early weaning with removal from the sow herd. Eradication of S. typhimurium from herds involves drastic measures, as have been implemented in Denmark. Poultry and other birds including pigeons and pheasants, serologically positive pigs, and cats and rodents were destroyed on a wide scale, and on one farm even the farmer's dog was killed when it was found to be shedding salmonellas. Since reinfection is likely, such measures may not be justified. Various strategies have been found to reduce the prevalence of salmonella infection in feed, including feeding wet rather than dry feed, mixing feed with whey rather than water, using naturally fermented feed, and acidifying feed. Since contamination that does not involve active shedding may occur at various points in the slaughter process, hygienic procedures are essential. It has been demonstrated that the employment of hazard analysis of critical contact point principles during the slaughter process has reduced the recovery of salmonellas from slaughtered pigs. Equine salmonellosis. Salmonellosis is an important infectious disease of horses of all ages, usually caused by non-host specific salmonellas, especially Salmonella typhimurium. The disease occurs in most countries and is diagnosed sporadically. Depending on the age group, the disease manifests as peracute septicemia, acute enterotyphlocolitis, chronic diarrhea, failure to thrive or, more rarely, polyarthritis, orchitis, fistulous withers or abortion. Salmonellosis may affect individual horses or, at times, it occurs in extensive epidemics in groups of horses that are at risk. Outbreaks in foals on stud farms have been reported in several countries. Foals and aged, debilitated or stressed horses are particularly susceptible. Asymptomatic carriers play an important role in the epidemiology of the disease. Nosocomial salmonella infections are common in large equine clinics or hospitals. Severe outbreaks in such institutions may force their temporary closure in order to control the disease. More than a century ago, the most common manifestation of equine salmonellosis was abortion due to the host-specific Salmonella abortusicae. Since then, the prevalence of abortion has declined markedly to the extent that isolations of S. abortusicae in the USA virtually ceased by the 1970s. Abortion is still a problem in India, where other Salmonella serovars are also implicated in the syndrome, as well as in Croatia, Italy, and Argentina. S. abortusicae was reported as the cause of purulent tendovaginitis, bursitis and pneumonia in horses. At least 40 of the known serovars of Salmonella have been isolated from horses. Several serovars may occur in contaminated environments at the same time, and the simultaneous infection of an animal with 2 or even more serovars is not uncommon. When this does occur, it is usually reason for a poor prognosis. Apart from typhimurium, other serovars isolated from cases of equid salmonellosis include enteritis, anatom, Newport, Heidelberg, Typhimurium variant Copenhagen, Cottbus, Dublin, St. Paul, Hadar, Ohio, Agona, and Krefeld. Some investigators regard Salmonella typhimurium and Typhimurium variant Copenhagen to be the most pathogenic, while others believe that anatom infection has the gravest prognosis. Numerous phage types of Typhimurium have been shown to be involved in equine infections. However, in most cases no clear conclusions can be reached regarding the origin of the various types, even of phage types known to originate from wild birds, such as finches, sparrows and pigeons. It appears that the susceptibility of horses when exposed to sufficient numbers of salmonellas, irrespective of sero or phage type, is similar to that in other animal species. The prevalence of salmonellosis in horses on stud farms has been reported to range from 0,36 to 27%. It has been estimated that up to 10% of horses in the USA may be infected with the organism at some time or another. In a recent study in the USA, the prevalence of fecal shedding of a Salmonella serovar in normal horses was 0.8%. Isolates from feces were from 8 serogroups and represented 14 serotypes, the most common being S. Munchen. Horses most frequently become infected via the oral route, although infection may also take place through the mucous membranes of the eyes and the nose via aerosol droplets. Experimental infection of horses can be achieved with oral doses. There are many environmental sources of infection, but particular problems are posed by contamination of water by effluent, contaminated feed, and dietary additives, as well as carrier birds, rodents, horses and other farm animal species that excrete the bacteria. In a recent study in the USA, the prevalence of salmonellas in grain and other concentrates used for horse feed was 0.4%. Isolates from feed represented 3 serotypes, none of which were also identified in the feces of shedding horses. An infected foal can excrete millions of organisms per gram of feces, resulting high environmental contamination. In a population of horses, up to 24% be asymptomatic carriers, based on fecal cultures. In one Australian study, 65% of the normal non-hospitalized horse population were found to be shedding salmonellas in their feces, while 23.8% of horses hospitalized in a veterinary teaching hospital were shedders. The prevalence of asymptomatic carriers in healthy adult horses, as assessed by culture of mesenteric lymph nodes at a slaughter facility, was 71.4%. On studs experiencing outbreaks of salmonellosis in foals, up to 30% of clinically normal foals may have salmonellas in their feces. The bacterium can be harbored by carrier animals in the mesenteric lymph nodes, liver, spleen or ileum. Asymptomatic carrier horses may or may not actively shed salmonellas in their feces. Shedders appear to play a major role in the dissemination of the organisms. It appears that stress can activate the infection in carrier animals, and it may not only enhance the fecal excretion of salmonella organisms but also sometimes precipitate overt clinical disease. Fecal excretion is intermittent, and while the numbers of salmonellas excreted are usually low, the quantities are sufficient to contaminate the environment to a threatening extent, particularly in areas of close confinement such as veterinary hospitals. True persistently infected carriers, such as occurs with host-adapted salmonellas, Dublin in cattle, probably rarely occur in horses. Most horses recovering from clinical salmonellosis shed salmonellas in their feces for less than 30 days. However, some may shed for up to 300 days. Various serovars of salmonella may be isolated from carriers but, in keeping with the prevalence of specific serovars, Typhimurium is most commonly isolated from both asymptomatic carriers and horses with clinical disease. 2 or even 3 serovars may, however, be isolated from an animal at any specific time. On horse stud farms where salmonellosis is endemic, salmonellas may frequently be isolated from soil samples from areas of high-density stocking, such as around water troughs, under trees, near gateways and in foaling paddocks. Salmonellas can survive in shaded soils for 9 months or more. Where horses are kept on properties that had previously been stocked with sheep and/or cattle, fecal contamination from these animals may be a source of infection for horses. Outbreaks most frequently occur during summer and autumn, when the ambient temperature is highest. This may reflect the optimal conditions for growth of the organism and susceptibility of the host. Salmonellosis in horses is rarely a simple cause and effect phenomenon, and the appearance of overt disease is generally regarded as being a sequel to one or more predisposing factors including debility, stress, such as that induced by long periods of transport, a new environment, new stablemates, hot humid weather, dietary changes, unfamiliar handlers, general anesthesia, surgery, excessive work, overtraining and intercurrent disease, and anthelmintic or antimicrobial therapy. It appears that the changes in gut flora that occur during stress or antimicrobial therapy allow salmonellas to multiply. Colic, abdominal surgery and the oral administration of antimicrobials appear to be important risk factors for the induction of salmonella infections. The chances of isolating salmonellas from horses are about 10 times greater in those that are receiving antimicrobial therapy than in those that are not. In addition, combined oral and parenteral antimicrobial treatment increases by 40-fold the chance of a horse contracting salmonellosis. The probability of salmonellas being isolated from horses suffering from colic is 2 to 5 times higher than it is from those that are presented with other medical complaints. Salmonellas were isolated from 55.3% of those horses that had fecal cultures performed because they had developed diarrhea after surgery for colic. Horses suffering from small colon impactions, especially those treated surgically, were found to be at increased risk for salmonellosis. Risk factors identified in studies have included high ambient temperature, dietary changes, development of diarrhea before or soon after admission, development of fever, development of leukopenia, impactions of the large colon, and nasogastric intubation. Nosocomial infections can result in significant morbidity in patients admitted to the hospital for reasons other than salmonellosis, elective surgery, and non-enteric medical disorders, and in many outbreaks the result is death or euthanasia for humane reasons of many patients. The epidemiology of the diseases caused by S. abortusequi is poorly understood. The bacterium occurs exclusively in equids, including donkeys, and causes abortion, genital infections, orchitis and arthritis. It does not occur in the intestinal tract and has not been isolated from feces. The role played by stallions in the dissemination of the organisms is unknown, but venereal transmission does appear to be a distinct possibility. Salmonella abortusicui is disseminated on stud farms by direct or indirect contact with the products of abortion that contain large numbers of organisms. A high prevalence of abortion generally occurs only in the first foaling season after the infection has been introduced. Thereafter, abortion is restricted to new arrivals. Infected mares may produce live foals, but most of them die shortly after birth. The pathogenesis of salmonellosis in horses has been poorly studied, but it is probably similar to that in other domestic species. Stress and other factors mentioned above play significant roles in the initiation, course and outcome of the disease. Pathogenic salmonellas invade the mucosa of the intestinal tract, where they are phagocytosed by macrophages and neutrophils. Salmonellas can survive within macrophages, and thus escape injury by the host immune system and many antimicrobials. Bacterial virulence factors and the inflammatory response by the host against the infection appear to contribute to the development of the disease. The clinical signs of enteric or septicemic salmonellosis in horses are similar to those occurring in the comparable disease in other species. Animals may manifest clinical signs and clinicopathologic responses within 24 to 72 hours of oral exposure to salmonellas, stressful events or other predisposing factors. In experimentally induced equine salmonellosis, an elevated body temperature is accompanied by a severe neutropenia during the first 5 days. This is followed by a rebound neutrophilia. The peak of pyrexia generally precedes the onset of diarrhea by 1 or 2 days. Animals suffering from diarrhea may exhibit a decrease in plasma proteins, and marked electrolyte and acid-base abnormalities. In general, 3 overlapping clinical forms of salmonellosis occur. The most severe is a peracute, fatal septicemic disease, most often affecting foals 1 to 6 months of age. Affected foals show fever, weakness, depression, lethargy and reduced appetite. Visible mucous membranes may appear muddy and petechiated. Signs of enteritis may be absent, or there may be increased borborygmus and a severe, fetid diarrhea containing mucus. The diarrhea may have a characteristic green color and may contain blood. If untreated, affected animals usually die within 24 to 72 hours. Complications of septicemic salmonellosis include acute, purulent meningitis, arthritis in one or more joints, physitis and osteomyelitis. Culture of salmonella from septic arthritis in foals is a significant indicator of a poor prognosis for survival. On affected studs, the annual foal mortality rate as a result of septicemic salmonellosis may range from 4 to 20%. The acute disease, which is the commonest form, is characterized initially by pyrexia, loss of appetite, a severe enterotyphlocolitis, tachycardia and dehydration. Mild colic may precede the onset of diarrhea. The course of the disease may extend over a period of several weeks. The fever and diarrhea may become intermittent as the disease progresses. The severity and duration of diarrhea depend on the infecting Salmonella serovar and host immunity. With appropriate therapy, these animals usually survive, despite dehydration and rapid weight loss. Septicemia may lead to organ localization, especially in foals. Complications of enterocolitis such as endotoxic shock, laminitis, thrombophlebitis, coagulopathies, acute renal failure and chronic malabsorption may result in increased morbidity and death. In some cases, euthanasia may need to be performed for humane reasons. The chronic form, which is the rarest, has a duration of 3 weeks to several months and is characterized by the passing of loose, soft feces, intermittent fever, poor appetite, significant weight loss and dehydration. Animals suffering from this form of the disease but with a shorter course often recover, while those that remain ill for more extended periods usually die after being terminally recumbent as a result of severe weakness. Proof of the etiological involvement of salmonellas in this form is often contentious. Other manifestations of salmonellosis in horses have been reported. Adult horses may only manifest fever, anorexia and severe depression in the absence of any other clinical signs. Mild infections may manifest only as colic without diarrhea. Colic of varying severity may be accompanied by diarrhea, or adynamic ileus and persistent gastric reflux, proximal enteritis. Pregnant mares infected with S. abortusicui usually abort during the last half of gestation. The incubation period is about 30 days. There are often no indications of impending abortion. Following abortion, the fetal membranes may be retained and there may be a abundant vaginal discharge. Lesions in animals that have died of the disease vary according to the syndrome from which they had suffered. In the peracute or acute septicemic disease, petechial and ecchymotic hemorrhages are present especially in serosal membranes, particularly the pericardium and peritoneum, and along the course of visceral blood vessels. Petechiae may be present in the heart valves, bladder mucosa, and renal and adrenal cortices. The renal cortices are generally pale in contrast to the medullary congestion which is often present. The spleen is enlarged and the lungs are congested and edematous. The gastric mucosa is intensely hyperemic, with some scattered hemorrhages and edema. There may be congestion and catarrhal inflammation of the small intestine and the visceral lymph nodes are enlarged, edematous, and may be hemorrhagic. In animals that have died from the acute enterotyphlocolitis syndrome, lesions are usually present in the mucosa of the entire cecum, which is severely hyperemic, and proximal large colon, and occasionally in the distal ileum. The lesions are those of a severe acute fibrin necrotic inflammatory process, often with small ulcers and occasionally multiple small abscesses in the gut wall. Affected parts of the gut wall may be edematous. The contents of the large intestine are watery and foul-smelling. Histologically, affected parts of the intestine reveal varying degrees of superficial mucosal necrosis, lymphocyte and neutrophil infiltration into the lamina propria, thrombosis of capillaries, lymphoid depletion in Peyer's patches, and the presence of occasional bacterial colonies. The necrotic mucosa may be covered by a fibrinocellular pseudomembrane. The germinal centers in mesenteric lymph nodes may also be depleted and bacterial colonies may be evident within sinuses. There are microscopic evidence of localization of the infection in other sites, with the development of lesions such as suppurative meningitis, cerebral abscessation, suppurative arthritis, and epiphyseal or metaphyseal osteomyelitis. Lesions in chronic salmonellosis are not nearly as marked as they are in the acute disease. A patchy fibrinous or ulcerative colitis or typhlitis may be present, and residual fibrotic intestinal adhesions may contribute to death following colic or adynamic ileus. Fetuses that have been aborted as a result of S. abortuseque infections are well formed with no anatomic abnormalities, and show relatively mild, nonspecific gross pathological changes such as subcutaneous edema, petechial hemorrhages and lung edema. The placentas from aborted mares that have aborted show striking lesions. Scattered chocolate brown necrotic foci are surrounded by areas of erythema and edema and occasional hemorrhages. Histologically, the placental lesions include edema, hemorrhage, prominent suppuration and masses of gram-negative rod-shaped bacteria. Salmonella abortuseque may also cause arthritis in foals and orchitis in stallions. The orchitis may be suppurative with abscess formation. Diagnosis: Salmonellosis may be suspected on the basis of history, physical examination findings, and supporting clinicopathologic data. For example, the rapid development of a marked neutropenia is a frequent portent of acute enteric salmonellosis. Because of the nonspecific clinical signs of the disease, the diagnosis should be confirmed by isolation of salmonellas from affected horses. Serological tests will have limited value in the establishment of a diagnosis, as most horses contain antibodies to salmonellas and because a rise in titer is not always marked during the course of the disease. A definitive diagnosis, determination of the origin of the causative bacteria, and control may require a detailed investigation including the serotyping, biotyping and phage typing of the organism, application of biochemical and antibiotic sensitivity tests, and perusal of hospital case records. In order to diagnose enteric salmonellosis antemortem, it is essential that serial fecal cultures be performed, as the isolation of salmonella from infected animals, even during the course of clinical disease, is inconsistent. Multiple fecal cultures are superior to single culture attempts. Rectal mucosal biopsy, a safe and rapid technique, is more sensitive, 52%, than fecal culture, 32%, in detecting salmonellas. When the two are used in combination, the success rate may rise to 60%. In order to enhance the laboratory detection of salmonellas, samples consisting of 20 to 50 grams feces are preferable to rectal swabs. Antimicrobial therapy do not eliminate salmonellas from the feces of infected horses, i.e., Salmonellas can still be cultured, even when isolates are sensitive to the antimicrobial being administered. Salmonellas survive in the refrigerator for 2 to 4 weeks. The use of selective and enrichment media, including tetrathionate or selenite broth, and brilliant green or Salmonella Shigella agar increase the likelihood of positive culture. Pre-enrichment with buffered peptone water may improve the sensitivity of culture media for salmonellas. Possible reasons for the difficulties in isolating salmonellas from carrier animals are that the organisms are shed intermittently or that they may be sublethally damaged by the host immune system, necessitating culturing in an enrichment medium to revive the organism. Horses suffering from subclinical infections excrete low numbers of organisms compared to horses with clinical salmonellosis. Methods for the detection of salmonellas in feces using the polymerase chain reaction, PCR, have been developed. These methods are more sensitive, more rapid and require the submission of fewer samples than for microbiologic culture. Both viable bacteria and non-viable DNA can be detected by application of PCR tests. While a positive PCR test on feces confirms that the horse is shedding salmonellas, viable or non-viable, the significance of PCR positive but culture negative horses with respect to environmental contamination is unclear. In live animals with the septicemic form, blood and/or appropriate samples from localized sites of infection, if present, can be cultured for salmonellas. The results of blood culture are, however, frequently disappointing. Salmonella serovars are readily cultured from specimens of the intestinal tract and the internal organs collected at necropsy from animals that have died of the septicemic form of the disease. Necropsy specimens for bacteriological examination should always include mesenteric and ileocolonic lymph nodes and sections of the wall of the cecum and proximal large colon, liver and spleen in separate containers. In cases of enteric salmonellosis, cultures made from tissues obtained after the death of the animal may be positive, even when antemortem fecal cultures were repeatedly negative. Serology is unlikely to be a reliable indicator of infection or immune status. In cases of abortion due to S. abortusque infection, the organism can be isolated from tissues of the aborted fetus, such as heart blood, internal organs, stomach and intestinal contents, and from the fetal membranes, as well as from swabs of the vaginal exudate of the mare. Depending on the syndrome, several diseases may be confused with salmonellosis. In young foals suffering from the septicemic form, a number of other bacterial diseases, particularly those caused by Escherichia coli, Actinobacillus equili, Klebsiella spp, and beta-hemolytic streptococci, should be considered. In the enteric form of salmonellosis in foals, conditions such as nutritional diarrhea, infections with rotavirus, certain strains of E. coli, Clostridium perfringens, Clostridium difficile, Rhodococcus equa, Cryptosporidium spp, or Giardia spp, and helminth-related diarrheas should be considered as differential diagnoses. Concurrent infections, as with rotavirus, may occur. In older animals suffering from acute enteric salmonellosis, differential diagnoses include endotoxic shock, C, perfringens type A or C. Difficile infections, acute peritonitis and typhlocollitis due to Ehrlichia infection, Potomac horse fever. In horses with colic due to salmonellosis, other causes of abdominal pain need to be differentiated. Differential diagnoses for horses suffering from persistent gastric reflux and other infectious causes of proximal enteritis, SC. Perfringens, and small intestinal obstructive lesions. The administration of certain antimicrobials, notably oxytetracycline, lincomycin, and less commonly tylosin, penicillins, cephalosporins, potentiated sulfonamides and erythromycin may precipitate acute colitis. Excessive dosages of nonsteroidal anti-inflammatory drugs have also been associated with diarrhea in horses. Chronic salmonellosis should be differentiated from strong-owl larval migrans, cyathostomosis, granulomatous enteritis, alimentary lymphosarcoma, chronic R. equa infection, sand enteropathy, chronic liver disease, food allergies and fermentative disorders. Apart from salmonellas, common causes of infectious arthritis and osteomyelitis, joint ill, in young foals, often with evidence of systemic illness, are E. coli, Klebsiella spp, beta-hemolytic streptococci, A. equili and R. equa. Control. All horses suspected to be infected with Salmonella should be regarded as positive for the organism and appropriate isolation measures instituted until such time as multiple fecal cultures, using enrichment techniques, are negative. Salmonellosis is a zoonotic disease and suitable precautions to avoid human infection should be applied. Supportive therapies, with the emphasis on intravenous fluid replacement, correction of electrolyte deficiencies and acid-base abnormalities, and good nursing are paramount in the treatment of salmonellosis. Successful treatment of acute enterocolitis is dependent on the ability to administer appropriate fluid therapy. Oral fluid replacement may increase the severity of the diarrhea. Antidiarrheal drugs such as bismuth subsalicylate or activated charcoal may be used, but these should be discontinued after 3 days if they have not produced a beneficial effect. Nonsteroidal anti-inflammatory drugs, such as low doses of flunixin meglumine, may be used for their anti-endotoxic effects. Other therapies aimed at ameliorating the effects of endotoxemia may also be considered. Plasma transfusions may help to alleviate the hypoproteinemia which develops as a consequence of the enteropathy. Antimicrobial therapy for the treatment of enteric salmonellosis in adult horses is of questionable value and does not necessarily result in the elimination of salmonellas from the intestinal tract. Organisms may still be isolated from the feces and tissues during and after the completion of the course of treatment. Antimicrobial therapy is more effective when initiated prior to the development of diarrhea, or when it is used to control systemic or septicemic salmonella infections. It should be kept in mind that once diarrhea has developed, oral antimicrobial treatment, particularly with oxytetracycline, may aggravate the severity of the diarrhea. Foals with either the enteric or septicemic forms of the disease should be treated with aggressive parenteral antimicrobial therapy due to the high mortality associated with these forms and the predisposition for localization of the infection. Parenteral antimicrobial therapy should also be considered for adult horses with enteric salmonellosis that have indwelling intravenous catheters or that are neutropenic. Multi-drug-resistant salmonellas have been isolated from horses in both the northern and southern hemispheres. Antimicrobial therapy should thus be based on local sensitivity patterns. Since salmonellas can survive intracellularly, lipid-soluble antimicrobials are preferred. Horses may succumb, despite appropriate and aggressive antimicrobial therapy. Animals may also survive the chronic disease but subsequently fail to reach their previous level of performance. During an outbreak, affected animals should be physically isolated and their feces and bedding burnt. Attendants should be acquainted with the dangers of spreading the infection and instructed in proper hygienic procedures. The feces of all other horses on the property should be cultured for salmonella on numerous occasions and positive animals should be isolated. Bedding, feed, water and other environmental samples should be cultured for salmonella. Sources of environmental contamination need to be identified. Other precautions for containing the infection should include the prevention of the contamination of the feed and water of all the horses in the establishment, and the control of flies and rodents. An animal which has been infected with salmonella should not be returned to its farm of origin, or allowed to mix with uninfected animals, until 5 consecutive specimens of its feces have proved to be negative for salmonellas. It has been suggested that daily fecal cultures for 3 to 4 weeks may be necessary to be reasonably certain that an animal is not shedding the bacterium. Suitable disinfection of veterinary equipment, tack and the environment should be performed following treatment of horses with salmonellosis. In a recent study, bleach was the most effective disinfectant on a range of common surfaces. Environmental cultures or PCR tests should be used to confirm successful disinfection, and can also be used to identify locations harboring the organism. Where there is heavy soil and environmental contamination, spraying with 5% formalin at monthly intervals has been shown to effectively kill salmonellas. To reduce the possibility of salmonellosis developing in horses admitted to veterinary hospitals, every effort must be made to minimize stress. Horses with normal hemogram should have surgery within the first 48 hours of admission to the hospital, or, if the hemogram is not within normal limits, surgery should be delayed for at least a week. Animals should be sent home as soon as possible after surgery. Protocols designed to attempt to prevent the development of nosocomial infections include strict isolation of horses admitted with diarrhea or that develop diarrhea following admission, rapid isolation of horses that develop clinical or clinicopathologic signs of salmonellosis, routine fecal cultures or PCR tests of patient populations deemed to be at risk, altering traffic patterns to minimize contact between patients, routine handwashing between patients, wearing protective clothing, plastic boots and gloves, to minimize cross-contamination, cessation of sharing equipment, as thermometers, nasogastric tubes, between patients, stringent stall cleaning and disinfection, and control of rodents and birds within the hospital. Commercial probiotic preparations failed to decrease the incidence of fecal salmonella shedding, or diarrhea, in horses admitted to a veterinary teaching hospital for colic surgery. Containment of nosocomial infections often requires aggressive disinfection procedures and/or closure of part or all of the hospital. The extensive use of formalin-killed bacterians has been reported in a number of countries, but controlled studies have not been undertaken to determine their efficacy. When a vaccine is used, it is imperative that the serovars prevailing in the outbreak in question be monitored against those present in the vaccine in order to determine whether or not its use is warranted. In order that colostrum-derived passive immunity can be provided in foals, pregnant mares should be vaccinated at least 30 days prior to foaling, while foals should be vaccinated at 2 to 3 months of age to effect control of the condition. A commercial vaccine containing washed cells of S. typhimurium is available for the control of foal salmonellosis. Preliminary studies on the development of an S. abortussequi vaccine for the control of outbreaks of abortion have shown that experimentally a beta-propiolactone inactivated chromalum vaccine provides better protection in mice than a formalin inactivated vaccine. When required, autogenous vaccines can be prepared for use in specific outbreaks. Management practices should lessen exposure of horses to possible sources of infection and also minimize stressful situations that may precipitate the disease. Prudent use of antimicrobial agents in horses is warranted to avoid antimicrobial-associated salmonellosis. Salmonella infections in poultry are classified as caused either by non-motile serotypes, Salmonella enterica serotype Gallinarum Pullorum for pullorum disease and Salmonella enterica serotype Gallinarum Gallinarum for fowl typhoid, or by the many motile paratyphoid Salmonella serotypes. These Salmonella infections have a worldwide distribution. As a result of testing and control programs, the incidence of Pullorum and Gallinarum infections has decreased dramatically. Historically, Salmonella enterica serotype arizonae was placed in its own category. However, it is now included with the paratyphoid Salmonella spp. Arizonae is an egg-transmitted infection affecting primarily young turkeys. In addition to the infections caused by the non-motile Salmonella named above, the presence of Salmonella paratyphoid species in poultry is common and has public health importance because of contaminated poultry product consumption. Pullorum and Gallinarum are highly host-adapted to chickens and turkeys. There are more than 2,500 non-host adapted species, paratyphoid, that may be transmitted to almost all animals. Pullorum disease is caused by vertically transmitted Salmonella enterica serotype Gallinarum Pullorum and is characterized by very high mortality rates in young chickens and turkeys. Affected birds huddle near the heat source, are anorectic, weak, lethargic, and have white fecal material pasted to the vent area. Affected birds may also have respiratory disease, blindness, or swollen joints. Serological testing is used as a surveillance tool, however, because of the potential for false negative or false positive results. Definitive diagnosis is made by isolation and identification of the organism. The goal for control of pullorum disease is elimination of the pathogen, particularly from breeding flocks, therefore, treatment is not recommended. Etiology of pullorum disease in poultry. Pullorum disease is caused by infection with Salmonella enterica serovar Gallinarum Pullorum, S. pullorum. S. pullorum are gram-negative non-sporogenic rods. They are non-motile under normal conditions and exhibit host specificity for poultry. Infections with Salmonella pullorum are usually vertically transmitted and cause very high mortality rates, potentially approaching 100%, in young chickens and turkeys within the first 2 to 3 weeks after hatching. In adult chickens, mortality rates may be high, however, frequently there are no clinical signs. Pullorum disease was once common but has been eradicated from commercial poultry stock in the U.S., although it may occur in other avian species, guinea fowl, quail, pheasants, sparrows, parrots, canaries, and bullfinches, and in small backyard or hobby flocks. Infection in mammals is rare, although experimental and natural infections have been reported: chimpanzees, rabbits, guinea pigs, chinchillas, pigs, kittens, foxes, dogs, swine, mink, cows, and wild rats. Transmission is usually vertical, transovarian, but also occurs via direct or indirect contact, respiratory or fecal, with infected birds or contaminated feed, water, or litter. Infection transmitted via egg or hatchery contamination usually results in death during the first few days of life up to 2 to 3 weeks. Transmission between farms is due to poor biosecurity. Clinical Pullorum disease may occur in all age groups, however, birds under 4 weeks old or younger are most commonly affected. Birds may die in the hatchery shortly after hatching. Affected birds exhibit the following clinical signs: huddling near a heat source, anorexia, weakness, whitish fecal pasting around the vent, diarrhea. Survivors are small in size, and frequently become subclinical affected carriers, with localized infection of the ovary. Some of the eggs laid by such hens hatch and produce infected progeny. Gross pathology of a chicken with oophoritis caused by infection by Salmonella enterica serotype Gallinarum Pullorum. Reveal pedunculated involuting ovarian follicles of abnormal shape containing white granuloma interspersed with small, grossly normal ovarian follicles. These findings are nonspecific and may be similar to other ovarian infections. There may be no lesions due to an acute septicemia and death. Lesions in young birds usually include unabsorbed yolk sacs and classic gray nodules in the liver, spleen, lungs, heart, gizzard, and intestine. Firm, cheesy material in the ceca, cecal cores, and raised plaques in the mucosa of the lower intestine are sometimes present. Occasionally, synovitis is prominent. Adult carriers usually have no gross lesions but may have nodular pericarditis, fibrinous peritonitis, or hemorrhagic, atrophic, regressing ovarian follicles with caseous contents. In mature chickens, chronic infections produce lesions indistinguishable from those of fowl typhoid, splenitis, pericarditis, oophoritis, and hepatitis. Diagnosis: serological testing to detect potentially positive birds. Isolation, identification, and serotyping to confirm infection. Lesions may be highly suggestive, however, diagnosis should be confirmed by isolation, identification, and serotyping of S. pullorum. Infections in mature birds can be identified by serological tests, followed by necropsy evaluation complemented by microbiological culture and typing for confirmation. Official testing recommendations for flocks with rapid assays for Salmonella. These will include PCR assay and lateral flow immunoassays. Some assays are for the general detection of all Salmonella spp. Further typing is required after these general detection assays. Other approved rapid assays are specific for Salmonella enterica serotype enteritis. Treatment not recommended. Treatment of flocks with pullorum disease or fowl typhoid will not alleviate the perpetuation of the carrier state and is not recommended. Control: preventing infection and eliminating positive birds and flocks. Control is based on routine serological testing of breeding stock to assure freedom from infection. Pullorum is a host-adapted Salmonella, and the usual source is other poultry by vertical or horizontal transmission. In addition, management and biosecurity measures should be taken to decrease the introduction of pullorum from feed, water, wild birds, rodents, insects, or humans. Birds should be purchased from sources free of pullorum. Fowl typhoid is caused by Salmonella enterica serotype Gallinarum and is characterized by mortality rates in young birds similar to those of Salmonella enterica serotype Gallinarum Pullorum, although mortality rates of Gallinarum are possibly higher in older birds. Younger birds are anorectic, weak, and depressed, and they have white fecal material pasted to the vent area. Affected birds may also have respiratory disease, blindness, or swollen joints. Older birds may be pale and dehydrated and have diarrhea. Lesions in older birds may include a swollen, friable, and often bile-stained liver, with or without necrotic foci, enlarged spleen and kidneys, anemia, and enteritis. Diagnosis is based on isolation and identification of the organism. The goal for control of fowl typhoid is elimination of the pathogen, therefore, treatment is not recommended. Etiology. The causative agent of fowl typhoid is Salmonella enterica serovar Gallinarum biovar Gallinarum and Salmonella enterica serotype Gallinarum biovar Pullorum. Those are gram-negative, non-motile, host-adapted avian pathogen belonging to Salmonella serogroup D. Epidemiology. The incidence of fowl typhoid is low in the US, Canada, and some European countries but much higher in other countries. Although Gallinarum is egg-transmitted and produces lesions in chicks and poults similar to those produced by Salmonella enterica serotype Gallinarum biovar Pullorum, Gallinarum has a much greater tendency to spread among growing or mature flocks. The mortality rate in young birds is similar to that in Pullorum infection but may be higher in older birds. Clinical findings and lesions. Fowl typhoid may be acute or chronic. Clinical signs and lesions in young birds are similar to those observed with S. pullorum infection. See the liver, ovary, and heart lesion practical works photographs. Older birds may be pale and dehydrated and have diarrhea. Lesions in older birds may include the following: enlarged liver with multiple white, coalescing necrotic lesions throughout, in an adult chicken infected with Salmonella enterica serotype Gallinarum biovar Gallinarum. Swollen, friable, and often bile-stained liver, with or without necrotic foci, enlarged spleen and kidneys, anemia, enteritis. Multiple flaccid or regressing ova with prominent thecal blood vessels in the ovary in an adult chicken infected with Salmonella enterica serotype Gallinarum biovar Gallinarum. Multiple petechial hemorrhages in the myocardium and the epicardial fat in an adult chicken infected with Salmonella enterica serotype Gallinarum biovar Gallinarum. Diagnosis: isolation and identification of the causative agent. Clinical signs and lesions of fowl typhoid are similar to those of pullorum disease, which is caused by pullorum. Therefore, diagnosis should be confirmed by isolation, identification, and serotyping of Gallinarum. Treatment and control. Treatment, not recommended. Control, eliminating the disease. There are no federally licensed vaccines in the U.S. In other countries, vaccines, killed or live attenuated, made from a rough strain of Gallinarum, 9R, have had variable results in controlling mortality rates. Vaccines derived from outer membrane proteins, mutant strains, and a virulence plasmid cured derivative of Gallinarum have shown promise in protecting birds against challenge. The standard serological tests for pullorum disease also detect fowl typhoid. Paratyphoid infections are caused by non-host adapted Salmonella spp. Clinical signs of paratyphoid infection occur in young birds but not usually in mature poultry. Hallmarks of the disease include lethargy, poor growth, weakness, diarrhea, and dehydration. Salmonella enterica serotype enteritis may cause diarrhea, decreased feed consumption, and decreased egg production in layers. Lesions in young birds may include an enlarged liver with focal necrosis, unabsorbed yolk sac, enteritis with necrotic lesions in the mucosa, and cecal CURS. Isolation, identification, and serotyping of the causative agent are essential for the diagnosis of paratyphoid infections. Serological testing is not highly reliable. Treatment is not recommended. Control measures include biosecurity and sanitation measures at the hatchery and poultry houses, elimination of vectors such as wild birds, rodents, pets, and flies, feed management, vaccination, and the use of competitive exclusion products. Paratyphoid infections caused by non-host adapted Salmonella spp. Are of public health importance because of the contamination and mishandling of poultry products. Paratyphoids are usually present in the intestinal tract of poultry without causing any disease. However, a few serotypes have the ability to cause disease in poultry, particularly when they are vertically transmitted. For example, Salmonella enterica serotype enteritis is a major food safety concern in the egg-laying industry. Fecal contamination of the eggshell is the main mode of transmission from breeders to progeny. However, S. enteritis is also transovarian transmitted. In addition, Salmonella enterica serotype typhimurium could potentially cause disease in poultry. Paratyphoid infections can be caused by any one of the many non-host adapted Salmonella. These Salmonella spp. infect many types of birds, mammals, reptiles, and insects. Paratyphoid infections do not necessarily cause disease in poultry, however, they are of public health importance via contamination and mishandling of poultry products. Salmonella enterica serotype Typhimurium, Enterica serotype Enteritis, Enterica serotype Kentucky, and Enterica serotype Heidelberg are among the most common salmonella infections in poultry. Some serotypes can be pathogenic to poultry as well. The prevalence of other species varies widely by geographic location. Transmission usually occurs horizontally from infected birds, contaminated environments, or infected rodents. Transmission of most serotypes to progeny from infected breeders is mainly through fecal contamination of the eggshell. However, enteritis and Enterica serotype arizonae can infect the interior of the egg through transovarial transmission. Infected birds remain carriers. Clinical signs of paratyphoid infection are observed in young birds, however, clinical disease is not usually found in mature poultry. Death in young birds is most often limited to the first few weeks after hatch. Although these clinical signs are not distinctive, the following are hallmarks of the disease: depression, poor growth, weakness, diarrhea, dehydration. Enteritis may cause diarrhea, decreased feed consumption, and decreased egg production in layers. Lesions in young birds may include an enlarged liver with focal necrosis, unabsorbed yolk sac, enteritis with necrotic lesions in the mucosa, and cecal CURS. Infections occasionally localize in the eye or synovial tissues. Conversely, there may be no lesions due to acute death caused by septicemia. Diagnosis: isolation, identification, and serotyping. Rapid antigen tests and PCR assays. Isolation, identification, and serotyping of the causative agent are essential for the diagnosis of paratyphoid infections. Serological testing is not highly reliable. Rapid antigen tests and PCR assays have been used to identify salmonella isolates such as Salmonella enteritis. Treatment and control. Control, biosecurity, sometimes including vaccination. Control measures for paratyphoid salmonella include the following: sanitation in the hatchery and poultry houses, elimination of vectors such as wild birds, rodents, pets, and flies, feed management, vaccination, use of competitive exclusion products. Treatment with antimicrobials is not recommended. Several antimicrobial agents help reduce mortality rate but cannot eliminate flock infection. Use may contribute to emergence of antimicrobial resistance. Salmonella enteritis is a major food safety concern, primarily for the egg-laying industry. The sources in commercial layers include breeders, contaminated environments, infected rodents, and contaminated feed. Transmission to progeny from breeders is mainly through eggshell contamination, although, unlike other paratyphoid Salmonella spp, transovarian transmission may also occur. The National Poultry Improvement Plan specifies Salmonella enteritis control measures in breeders, including depopulation of infected breeder flocks, cleaning and disinfection of pullet and layer houses, rodent control programs, pest management, feed management, use of competitive exclusion products, vaccination, biosecurity, and proper handling and refrigeration of eggs. Arizonosis. Other names: Arizona infection, avian arizonosis. Introduction. Caused by the bacterium Salmonella arizona hinshawi, renamed Salmonella arizonae. It affects turkeys, mainly in North America, and is not present in the UK turkey population. Mortality is 10 to 50% in young birds, older birds are asymptomatic carriers. Transmission is vertical, transovarian, and also horizontal, through fecal contamination of environment, feed, from long-term intestinal carriers, rodents, reptiles. Arizonosis is a septicemic disease of primarily young chicks caused by the bacterium Salmonella enterica subspecies arizonae. The disease can be acute or chronic and occurs worldwide, wherever flocks are raised. Salmonella arizonae has the ability to elaborate endotoxins, resulting in inflammation in multiple organs, most notably in the yolk sac, brain, eye, ceca, and bloodstream of young birds. Salmonella arizonae is an egg-transmitted disease, meaning infected adult breeding birds are usually carriers which spread the bacteria to their young through their eggs. Rodents, wild birds, and reptiles can also transmit S. arizonae into the environment. Clinical signs: inappetence, diarrhea, vent pasting, nervous signs, paralysis, blindness, cloudiness in eye, huddling near heat, postmortem lesions, enlarged mottled liver, unabsorbed yolk sac, congestion of duodenum, cheesy plugs in intestine or cecum, foci in lungs, salpingitis, ophthalmitis, pericarditis, parahepatitis. Diagnosis: isolation and identification, method same as for Salmonella spp. Differentiate from another Salmonellosis, coli septicemia. Treatment: injection of streptomycin, spectinomycin, or gentamicin at the hatchery is used in some countries. Formerly in-feed medication with nitrofurans was also used. Prevention: eradicate from breeder population, fumigation of hatching eggs, good nest and hatchery hygiene, inject eggs or poults with antibiotics, monitor sensitivity.